Bonsoir, mesdames et messieurs. Ladies and gentlemen, please sit down. The conference will now be starting. I'm Michel Gaudet. I'm the Vice President and the I'm the Vice President of the Association and the Executive Director. And pour ceux qui ont besoin de traduction, si vous ne l'avez pas fait, vous pouvez vous ramasser un casque de traduction juste à l'entrée. So welcome to our conference. We're proud to present this conference titled Toxic Legacy and Gender Inequality. Before I hand over the chair of this conference to Dr. Barry Breger, on behalf of the board of the association, I wish to sincerely thank the following people who have helped to make this conference possible. For his collaboration and support, Dr. Paul Leroux from McGill, thank you very much. Occupational Health Program Director, Department of Epidemiology, Biostatistics, and Occupational Health, McGill University. Paula De Chico, naturopathic doctor. She has a table upstairs. She's one of our financial supporters for this conference. We thank her a lot. It's thanks to people like her that we can hold these events. Our sponsors for today are Dr. De Chico, as I mentioned, Santé Mobile A1, Bain Viva, BAT, and Madame Bastin, who has a table also upstairs. The many volunteers who work tirelessly to make this conference a success, including our youngest volunteer, Fiona, she's 6 months old, who accompanied her mother, Megan, everywhere to advertise the conference. To all our organizations and groups who have supported this conference, at last but not least, our speaker for the evening, Dr. John Molot, and our chair, Dr. Breger. Our sincere thanks to all. I would also like to bring to your attention to a petition that we have launched to be presented to the National Assembly of Quebec for scent and fragrance-free healthcare spaces and the use of leased to non-toxic products in those spaces. Please sign the petition and also take some with you and return the original to us when it's filled. You will learn from this conference why this is so important for us to have scent-free health care spaces. We are requesting everyone to join us to get signatures on our petition. Thank you. And finally, I present to you our chair for the evening, Dr. Barry Breger. Dr. Barry Breger is a family doctor who has worked in the Laurentian communities of Saint-Sauveur and Saint-Agathe, as well as Saint-Agathe Hospital since 1987. He now practices primarily in Montreal for the past 14 years. He received his medical degree from the Université Scientifique et Médicale de Grenoble in France in 1981. Subsequently, he completed his residency at Memorial University of Newfoundland in St. John's and became a certificate to the College of Family Physicians of Canada, or CCFP. Having earned his residency, Dr. Breger then worked as a family doctor in various communities in Newfoundland. He also worked in the emergency department at St. Clair's Hospital in St. John's, and then traveled across the country to work in isolated First Nation communities in Manitoba and Ontario. Since the late 60s, Barry has been interested in nutritional and orthomolecular medicine, having read many books on the subject, the most notable being Vitamin C, The Flu and the Common Cold, by Linus Pauling, winning of 2 unshared Nobel Prizes. In 2000, Barry met a group of people who had been exposed to a fine drizzle of pesticide and fungicide spraying by a farmer adjoining their farm. Thus began his education concerning environmental sensitivity for these people subsequent to their toxic chemical poisoning became environmentally hypersensible. This path eventually led him to the association with EHAQ, which is the Environmental Health Association of Quebec, and to him moderating today the conference. Without further ado, please welcome Dr. Barry Breger.
Can you hear me okay? Yeah? After Dr. Molot's presentation, there'll be time for maybe 20 minutes, half hour of questions. And we'll do that. We'll set up a microphone afterwards. Thank you very much, Michel. As Michel mentioned, my first exposure to multiple chemical sensitivities was around the year 2000, 2001, when I met a group of people who had been sprayed by a neighboring farmer. They were on their small farm, and they were sprayed by a neighboring farmer, and there was a very fine drizzle of pesticide, fungicides, insecticides that came down on them. This was in 1997. I met them 3-4 years later, so that when I met them, what they were suffering from was obviously not from the acute intoxication. They had a whole host of symptoms that they were suffering from, but to different extent, depending on who was examined, on who was telling their story. So the worst of them had multiple chemical sensitivity. Those are people who are sensitive to a range of chemical products, could be perfumes, soaps, cleaning fluids, the exhaust from a car, the smells that we smell in a building, and also fibromyalgia and chronic fatigue syndrome. Those three often accompany each other. Oftentimes there are two of them or even all three of them that people are suffering from. So 3 years later, 4 years later, they had the multiple chemical sensitivities. There were 4 adults and 3 children and a whole host of animals who were rained on by the pesticide. The farmer in the field next door was spraying, number one, illegal pesticides, which is a whole other story, which I won't go into, but he was spraying it illegally in that there was more than a 3 or 5 kilometer an hour wind that was blowing. There was quite a wind blowing. And the law states that you should not be spraying because obviously the spray will pass everywhere rather than just on the field. So they got hit by this. One of the adults recovered quite well, completely. Of the 3 children, one is still suffering to this day. Another adult has been lost to follow-up. One of the males, one of the adults, still has chronic fatigue syndrome, fibromyalgia, and multiple chemical sensitivity. We're talking 17 years later. And he's had all sorts of cognitive problems. He's even had epileptic fits, and there have been all sorts of, nobody could really figure out what his problems are. He's been in and out of the hospital many times, has only been able to work intermittently, and finally had to stop. And the owner of the farm, first of all, she lost her farm, which was being started in order to start a business raising Angora goats. Every single goat died, and she still has multiple chemical sensitivity, fibromyalgia, and chronic fatigue. Admittedly, a lot better than it was in the past. But when she gets sick, it affects the immune system in many people. When she gets sick very quickly and very severely. So if there's a urinary tract infection, she goes from feeling fine to being having the worst urinary tract infection that you could imagine, or pneumonia or sinusitis, and has been hospitalized many times for that. So that was my introduction. Subsequently, I started to see more and more people with multiple chemical sensitivity. Years later, I had no idea really the extent of the problem. Over the years, I've been seeing a lot of people with chronic fatigue syndrome and fibromyalgia. And the chronic fatigue syndrome resembled a lot the patients who had burnout back in the day before we knew the words chronic fatigue syndrome. As I went back, as I learned about multiple chemical sensitivity, where people are sensitive to a multitude of chemicals, it affects multiple body systems, the brain, the neuroimmune system, neuroendocrinian, the endocrinian system, could affect the lungs, could affect the digestive tract. It affects multiple systems. And it gets better when, might not be cured, but it gets better when you get away from the chemical that's provoking it. So I went back and started asking a lot of the patients that I'd been following with chronic fatigue syndrome, whether they were sensitive to chemicals, and lo and behold, a great percentage of them were sensitive to multiple chemicals. I had just never asked the question. And they just naturally avoided the chemicals. They wouldn't put on, the women wouldn't, well, it's mostly women, they wouldn't put on makeup, and they would be very careful about what cleaning products they used. They would only use so-called natural cleaning products. And they'd have to keep away from public places where there'd be all sorts of smells and odors. So the three entities, the three syndromes, because we don't really understand, as far as I know, why it happens. And it happens to some people very severely, and other people don't get anything exposed to the same provocation. And those people we've started to call canaries, in reference to the canaries in the mines that in the old days, people used to take, the miners used to take a canary in a cage down in the mine, and when the canary stopped singing or literally fell down, they'd know that there were toxic gases in the mine and they had to get out. The canary was a lot more sensitive than the human beings were, so they had to pay attention. And these people aren't recognized. I'm not even sure if it's a recognized diagnosis in Quebec yet. So a lot of the people have to stop working because they can no longer work. They're too exhausted. They have too many symptoms. They can't think straight. They can't memorize anything. They can't function. And they're not recognized. Oftentimes the families think that their wife or their daughter or their mother is a bit strange. And when they stop work, of course, the insurance companies or the employer will send them to see an expert, oftentimes a psychiatrist, for multiple chemical sensitivity or any of the other two. And of course, they come back with no psychiatric diagnosis. That's one of the diagnoses that they get, that there isn't a psychiatric diagnosis. Or they get diagnosed as having depression and are given another chemical. They're given an antidepressant, which oftentimes they can't take because that's another chemical that they get a lot of side effects from. And if they get acutely ill, as one of my patients did, I got a call at 12:30 in the morning last week, and a patient of mine was having an acute asthmatic attack. She had been exposed to some perfume or shampoo and was terrified to go to the hospital, because the hospital, as we all know, is filled with all sorts of chemicals, all sorts of smells. We all know that a hospital has a smell. You walk into the hospital, there's the hospital smell. Well, those are all volatile chemicals that we're smelling, and these people get very sick in the hospital. So when they go to the hospital, they will get sicker. So this person has heart problems, gets an acute asthmatic attack, and is terrified to go to the hospital because they might give her a bronchodilator, but she might drop dead of a heart attack from the provocation of the chemical attack that she'll be feeling. That's why I'm so happy to see so many people here. The word is starting to get out, because people are not recognizing it, and the hospitals don't recognize it. They're just starting, and the specialists don't recognize it. They're just starting. We're now able to diagnose chronic fatigue syndrome, at least I feel, chronic fatigue syndrome and fibromyalgia, without everybody looking at us as if we're totally crazy. But multiple chemical sensitivity still has a way to go. So it's wonderful that Dr. Molot is coming here to speak to us about it. Dr. Molot got his medical degree in 1971 in Ottawa. Excuse me. He did a residency in internal medicine at the Montreal General Hospital before getting his certification at the College of Family Physicians in 1982. Early on, well before most of us were aware of environmental medicine, certainly before I was aware of environmental medicine, Dr. Molot took a primary instructional course in environmental medicine offered in Hamilton, Ontario, back in 1981. Since then, it would be fair to say that he has done hundreds of hours of training courses, both in Canada and the USA, related to the practice of environmental medicine. He initially practiced as a family physician from 73 to 86, but since 1986, he has restricted his practice to environmental medicine. In 2006, he worked as the medical legal liaison at the Environmental Health Clinic at Women's College Hospital in Toronto. In 2007, he became staff physician at the Environmental Health Clinic at the Women's College Hospital. Since 1987, Dr. Molot has lectured extensively on a wide range of topics related to environmental medicine. I'll just give you a brief overview of some of the topics. There were a list of about 40-some lectures that he's given over these years. I'll give you a list of some of them because I think they're very telling and very interesting. Back in 1987, he gave a talk on psychoneuroimmunology in environmental medicine, presented at the Advanced Scientific Seminar for the American Academy of Environmental Medicine in Nashville, Tennessee. There was another talk in 1988 on psychological studies of patients with environmental illness, presented to the Medical Symposium on the effects of the environment on man in health and disease in Toronto. In 1996, he presented a report to the Task Force on Material Emissions Green Building Information Council in Ottawa, and was a facilitator at the workshop on sick building syndrome and multiple chemical sensitivity, the College of Family Practice in Ontario at their annual scientific seminar. 2003, there was a presentation at the workshop on molds, indoor air, and health effects for a conference on environmental health, the Ontario College of Family Physicians. 2004, an environmental and health workshop on linking chronic complex conditions to environmental exposures, again for the Canadian College of Family Physicians. Environmental and health workshop on indoor and outdoor air impacts on human health for Canadian College of Family Physicians. And in 2010, a presentation to the National Network on Environment and Women's Health entitled Human Exposure to Chemicals in the Environment, Sex and Gender Implications, Scientific Literature and Clinical Experience, as well as a presentation to the Canadian Environmental Law Association called Multiple Chemical Sensitivity. And the last one I'll cite was in 2013, talked about environmental illnesses. The talk was called Chronic Pain, Fatigue, and Chemical Intolerance Linked to Environmental Exposure, Office Assessment and Management, as well as Common Chronic Illnesses and the Environment. That was also the entire Ontario College of Family Physicians for main Pro C workshops. Dr. Molot is and has been very active on various committees advocating for environmental health. He was a founding member in 1985 of the Canadian Society for Environmental Medicine and served as its president in 1991 and from 1995 to 2001. In 1993, served as a medical advisor for a pilot project on sick building syndrome for Public Works Canada. He was a medical advisor, a member of committees studying or advocating for the environment for various bodies, including the College of Family Practice of Ontario, Public Works Canada, the NFB, for a film entitled Air, the Canada Mortgage and Housing Corporation, and the Department of Public Health Sciences of U of T, among others. He's authored or co-authored multiple academic papers for the Canadian Society for Environmental Medicine, the Canadian Human Rights Commission, the Health Protection Branch of Health Canada, the Canadian Transportation Authority, the Canadian Environmental Law Association, and the Ontario Ministry of Health, amongst others. He has served as an expert witness in 15 different legal cases before the courts or various other bodies, like the CSST here in Quebec or the Workers' Compensation Boards elsewhere. In recognition of outstanding contribution to environmental medicine in Canada, the Canadian Society for Environmental Medicine presented Dr. Molot with the John McLennan Award in 2001. And in 2003, he was granted the fellowship by the College of Family Physicians of Canada for contribution to the enhancement of medicine. Without further ado, I would like to introduce you to Dr. Molot, speaking about a topic I am very much looking forward to hearing about. The title of the talk is Toxic Legacy and Gender Inequality. Women are most susceptible to the effects of the environment on health, how you can safeguard yourself from harm. Dr. Molot.
Can you hear me okay? This is working? So I have to start off by saying when Barry said I had given papers 40 times, I was shocked. So one of the things that you're going to learn about me tonight, if you haven't figured it out already, is that I really never shut up. So this was last year, and there was I guess a message that wanted to be driven home to the public from the Association Société Environnementale de Québec. This is their logo. And all of these happened. And this evening happened because of the work of Rohini Paris, and I felt she deserves a special thanks. Wherever you are, Rohini, thank you. The work you do is amazing. So this is what the talk is about tonight. You need to understand the biology of multiple chemical sensitivities and why people with MCS are really canaries. The objective is also to understand how environmental exposures are changing health patterns of chronic disease. And thirdly, to understand why women are more susceptible to these effects. All three objectives are connected. And in order to understand number 3, why women are more susceptible, you need to understand number 1 and number 2 first. So, ladies, you got to bear with me here and be patient because I'm not going to talk about you very much for a while. So, this is my dad. He was a storyteller, and I'm a storyteller. They took this picture in the golf course when he was 91 years old. Everybody knew my father. He was always telling stories. Because he was my father, I heard many of the stories many, many times. And so some of you are going to hear stories tonight. If you've heard me speak in the past, you're going to hear them again. So I apologize for any boring things that you may hear. So these are people with chemical sensitivities. And this is, in Quebec, the group that represents these people. And as Barry said, they refer to themselves as canaries in the coal mine. You've heard the story about why they're canaries, why people with chemical sensitivities seem to be warning everybody else about chemicals. As I tell you, I've been doing this 30 years. I've seen many, many people, 12,000 approximately, of people with environmental sensitivities in 30 years. And I used to think, guys aren't really canaries. I never said that because I didn't want to be mean, but I didn't understand, why are you canaries? If you're a canary, you're warning everybody else about the environment, but you're not a canary if there's something wrong with you, and that's why you're reacting to these chemicals. So it took me a long time. Are MCS people really canaries? Are they really warning us about chemicals being dangerous, or is there something wrong with them? And if there is something wrong with the rest of us, what are they warning us about? So you need to understand about environmental medicine. Environmental medicine recognizes, treats, and prevents illnesses induced or impacted by exposure to chemicals that we can have contact with from air, food, or water. It also considers the impact of the environment on many common illnesses such as diabetes, cardiovascular disease, allergies, respiratory conditions, neurodegenerative disorders, neurodevelopmental disorders in kids. But clinically, we see the entities that Barry was talking about. This is what I see every day in my office: chronic fatigue syndrome, fibromyalgia, sick building syndrome, chemical sensitivities, all of the above, every day. The approach we take is multidiscipline. And it's a systems integration approach. And what that means is normally when you go to a physician, he asks you, what's the matter? And if you say something like chest pain, he starts thinking about questions. Does it hurt when you move? Does it hurt when you swallow? Does it hurt when you breathe? Does it only hurt when you're walking uphill? Because we're trying to figure out what's the organ system. we're trained to do that. I have a stepson who is now a resident in internal medicine. When he was in third year medicine, he got asked the same question in third year medicine that I did in an oral exam 40 years previously, which is, if you have retrosternal chest pain, what's your differential diagnosis? What are all the possible causes they could be? And we're being tested to see not if we've memorized all the answers off by heart in alphabetical order, but are you starting to think like a doctor? Because the doctor has to reduce it down to what is the diagnosis. And it is a fantastic way to think. We can problem solve. When you show up and emerge, that's what that doctor is doing. It doesn't work very well for chronic illnesses, because chronic illnesses involve multiple systems on multiple levels, and you need to start integrating systems. And it may not be very clear, but it's going to be explained during this talk. So this is the pattern of environmental illness. Multiple systems are involved, and the brain is the most common system. You see fatigue, poor cognition, chronic pain, disturbed sleep, mood changes, autonomic nervous system dysfunction. The autonomic nervous system is, when I was in med school, I thought they misspelled it, that it meant the automatic nervous system, because it's talking about automatic functioning, such as the temperature in your skin or blood flow. There's a balance going on all the time. If it's cold in here right now, the circulation in your skin will slow down because we're trying to conserve heat. And the opposite is if it's too warm in here. In fact, if it stimulates your skin enough, you may start to sweat. That's the autonomic nervous system, and it's off in patients with environmental sensitivities. There's more. Tied for second place, gastrointestinal and respiratory symptoms. These patients are more likely to have allergies, food sensitivities, chemical intolerance, eczema, irritable bowel syndrome, or gastroesophageal reflux disease, which is short for heartburn. Irritable bladders. Actually, I used to joke and state that if my patients were to ever get a First Nations name, it would be Little Bladder. You look for humor if you can. Migraine headaches. They're sensitive to weather, heat, cold, light. I got weather twice. They're really sensitive to weather. Stress changes and so on, personal stress in life. They're more sensitive to these things. And the lab tests, most of the time, are normal. And 70 to 90% of them are middle-aged women. It's one of the perks of my practice. So the learning objectives. You need to understand the biology of chemical sensitivities and why they really are canaries. So you need to understand what chemical sensitivity is for those of you who don't have it. Basically, the most significant part is number 3. Low levels of exposure, which were previously tolerated by most other people, result in the manifestation of symptoms. That's basically it. The rest of the things are things that were taken from various diagnoses that have been attempted. We need to diagnose, we need to have case criteria, we need to get good populations in order to do proper studies. So there's been many, many attempts. This particular list was developed by a group of experts, so it's called the consensus case criteria. And at the same time that was happening, the docs at Women's College Hospital in Toronto validated these as the most consistent criteria to separate people with chemical sensitivity from normal people. Low levels of exposure. And the symptoms improve when you stay away from them. Seems really simple. Is chemical sensitivity a psychiatric diagnosis? I actually went forwards here for a minute. I just wanted to show you that one of the other things that we found at Women's was that the central nervous system had 4 strong components to it. The patients describe a stronger sense of smell. I will tell you in the medical literature that when people have tried to test it, however they try and test it, they haven't been able to observe it. But you'll see that over and over and over again. I once had a patient in my office, and she said, somebody in your office is smoking a cigar. Nobody smokes cigars in my office. And this was at the beginning of my practice in this field, and so I had a lot of skepticism. So I said, nobody's smoking a cigar. She said, yes, there is, I can smell it. So she clearly had a either a delusion or an annoying personality. Something was wrong with her. And in order to confront her with this, I went to the offices on each side of my office and across the hall, and I came back and I said, nobody on the entire floor is smoking a cigar. She said, well, there is somebody. Well, I really, it's time to cut to the chase here. I wanted to make sure it was right. So I went downstairs, and in the office below me, there was a man smoking a cigar. So once again, I was given a dose of humility. So is chemical sensitivity a psychiatric diagnosis? Because that's what you hear over and over again. The symptoms overlap. Sounds like anxiety or depression, panic. And somatoform disorder is a psychiatric illness where people feel physical complaints which have no biological validity, and they're being driven by anxiety and stress, just not being expressed properly. There's no biological markers. You can't find anything wrong with these people. You can't do a multiple chemical sensitive blood test because it hasn't been invented. There's an increased frequency of previously diagnosed psychiatric illness in the general population. And so if you show up at a doc and you say, I have multiple chemical sensitivities, and he says, well, have you ever had psychiatric problems? And you say, yes, well, that to him will explain why. The doses of chemical exposures which purportedly provoke symptoms are very low and tolerated by most other people. So if you have chemical sensitivities, you look odd. The syndrome does not fit the toxicology paradigm, which means the dose makes the poison. And what that means is everything at a certain dose is poisonous. If you drink 25 glasses of water, one after the other, you will be in the hospital because everything is going to be out of whack in your system. Even water can be toxic. You just have to find the right dose. So when you compare psychiatric illness and chemical sensitivity, what do you get? No biological markers. These effects are behavioral. There is actually a paper published within the last, I can't remember now, year or two, comparing MCS patients to hermits. Mood is off, sleep is off, pain is off, cognition. And people complain, I can't find the right word. And unfortunately, most of my patients do it so eloquently that they don't sound like it's off. But they'll tell me, I have difficulty finding words. And even now, as I'm talking to you, I sometimes have difficulty finding words, but I'm thinking about what I'm saying, so I go around it. So I don't look as stupid as I am. Autonomic function is off. You see that with psychiatric illness. There's an increased incidence of migraine, irritable bowel syndrome, idiopathic urticaria, which is hives. And these things are also seen more in people diagnosed with psychiatric illness. What complicates things is how do you improve that people have chemical sensitivities? So a brilliant idea done by many researchers is to take people with chemical sensitivities, bring them into a lab, challenge them with chemical exposures, compare them to control groups or compare them to sham or fake or placebo type exposures to see if they can really tell the difference when they're blinded, meaning they don't know, or double-blinded, which means even the researcher doesn't know. So there was a review of 34 studies of challenges. And what did they find? Well, in 21 of them, the odor was probably apparent. 19 of these papers actually showed a positive correlation. Seems to be something wrong with these people. But they don't really count because there was no blinding. The patients could tell the chemical exposure. 3 of them, they put nose clips on the face, and it confirmed a response. But the people who were looking at the studies dismissed them, they said, because they could still feel it in their eyes. 7 studies used chemicals below odor thresholds, can't smell them. And 6 of the studies failed to show consistent reactions. So therefore, it kind of was a blinded study, which was negative. 3 studies, they actually use a masking agent. What that means is they used a chemical odor to hide the first chemical odor with a stronger odor. And the patients with chemical sensitivities reacted to both. So clearly, they couldn't tell the difference between a real chemical and a sham. And therefore, it was further proof that these patients are nuts. Okay. So the conclusion by the author was chemical sensitivities does not exist. So I criticize him, and you probably already have. You can't do these tests blindly very well. It's really hard. You're going way too low, or you're hiding it with another chemical. Some studies, though, actually challenged one chemical. They challenged one chemical. If the patients couldn't tell, they sent them home. There was no washout period, which means once the patient said, I think I'm reacting, they didn't wait for the person to feel better before they started challenging with other things, and of course that just confused the issue. The studies were not done in a de-adapted state, which means they didn't put these people in a place which was really chemically clean. Conclusion? This is what they should have figured out. We don't know how to do double-blind challenge studies. We need to design better research. Meanwhile, you're getting papers like this. Psychiatric and somatic disorders and multiple chemical sensitivity in 264 environmental patients. And this is what they said. That's terrible. Sorry about that. What it says is, in most cases, symptoms can be explained by well-defined psychiatric and medical conditions other than multiple chemical sensitivities, and they need specific treatment. In other words, it's a psychiatric illness, and if they have treatment for anxiety or depression, phobia, whatever, they can be helped significantly. So let's look at what's in the literature. What supports this? Suggestions for treatment have included cognitive behavioral therapy. It's a commonly used technique to treat people with anxiety and depression. Relaxation therapy with deconditioning. What that means is teach the patients to relax, calm down, start exposing them to chemicals, and see if, when you're more relaxed, if you can turn off your symptoms. And psychotherapeutic medications, anti-anxiety and antidepressant medications. The level of evidence demonstrating any efficacy of these treatments in the medical literature in the 30 years that I've been practicing this is almost non-existent. There's only been a few case reports. That's it. There they are. The last study was published 14 years ago. So there was a survey done of these patients, help versus harm. Basically they're saying, is this treatment more likely to be beneficial than harmful? That's the practice of medicine. First, do no harm. And if you're going to take risk of harm, and we all do, if we take risk from harm, it has to be worth it. Chemotherapy might wipe out your bone marrow, but it may save your life from cancer. It's worth doing. We have ethicians, or however you pronounce that word, people who practice ethics, who tell us that if you're going to take a risk, it has to be worth it. So when they looked at these patients, the help-harm ratio, living in a chemically free space was 155 times more likely to make you feel better than do any harm. Chemical avoidance, 119 to 1. Psychotherapy to help cope. Help cope. I didn't say to help treat, but to help cope, which actually is a form of treatment, 6 to 1. Psychotherapy for MCS to cure, 1 to 1. And I would actually challenge that, because if you're telling somebody, if the message is you have a psychiatric illness when you don't, you're actually interfering with the support system that may be surrounding that patient, such as spouse, family members, and so on. Anti-anxiety, antidepressant medications, 0.3 to 1. In other words, more likely to cause harm from taking the medication than to get benefit. That's the study. So if MCS is a physical illness, then we need evidence. We need animal models. We need biological markers. We need supportive double-blind challenge studies. And we got to shift the toxicology paradigm because maybe it's outdated. By the way, it's only 500 years old. Multiple chemical sensitivities is biological. We have all of these things, and this is where I'm going to show you the evidence. So, time for story. My father was a storyteller, so am I. So go back to the learning objectives. In order to understand the biology of chemical sensitivities and why they are canaries, we need to understand how environmental exposures are changing health patterns of chronic disease in general. And I'll go back to the chemical sensitivities after. So this is a picture of me that one of my patients made. And what it says is, I'm so busy. When I started this practice, I was over 6 feet tall. And I actually came running into the room where she was waiting for me, way behind on my schedule, and I said that. I didn't remember it until she gave me this as a present. So it was time for a holiday, clearly, when you're that frantic that you start to shrink. So my wife took me to Florida. There's Florida. And here's where I have a problem. Because when I go someplace to relax, I bring my computer. I always have to think, if not talk. So I went to this conference in Miami, and it was looking at environmental stress and development origin of disease, and I really didn't intend to spend much time at this conference because most of the papers being given were on mice and rats. And they don't make appointments in my office. They're not covered by OHIP. So here's what I learned. We're changing gene function. And this is what they showed us. So if you look at the top row of mice or rats, if you expose a pregnant female rat to a chemical, you don't just expose the rat, you expose the offspring. And you also, assuming that the offspring is female, expose the female offspring, even male offspring, you expose their gametes, which is the future sperm and eggs, to the chemical, which means it should go through 3 generations. The pregnant one, the offspring, and the grandmouse. But what they showed is it goes 4 generations. The second row is exposed males, obviously not pregnant. So it's not just the sperm, but it's the offspring again. So what they were showing is there's an effect on how genes are functioning that isn't being repaired. It's being passed on. So there's actually a big article, made the cover of Time magazine, Why Your DNA Isn't Your Destiny. The new science of epigenetics. Epigenetics is, we all know what the epidermis is. Epidermis is your skin, it's the covering of your body. And there's something called the epigenome. It is the covering of your genes. This is how genes work. It's amazing how anything works in the human body. But genes work, I'll let you in on a secret, I didn't always have gray hair. And so something happened to me when I got into my 50s and I started to change. So I always have a gene for gray hair, but it wasn't turned on. And it got turned on by some kind of programming later in life. And other things got turned off, which we won't discuss. But this is the epigenome at work, covering and uncovering genes. When they're uncovered, they're active. When they're covered, they're not active. And they're showing that the pollutants that we're being exposed to have the potential to damage the epigenome. So it doesn't just affect you, it also affects your kids, your grandchildren. Genes are covered by an epigenome. They're activated when uncovered. So it's passed on for 4 generations is a significant, to me, that was a shock. I didn't know that. So that was a turning point. And I came up with this term. It's chemical evolution. So all the mess we're creating in the planet is maybe starting to affect our as yet unborn grandchildren. So there's more that's in the medical literature for those of you interested in looking at these things more closely. And this is just a citation, PP-Tox, it's Toxicology of Pediatrics, Environmental Stresses and Developmental Origins of Disease, Evidence and Mechanisms. They've had another conference. There's another one coming up. Kind of raises a question. And, you know, with what are we doing is what I wrote, but the question really is, what the hell are we doing? In utero exposures, in the uterus before birth and risk, this is what we're finding. This is what the rat people are showing that we can associate with human studies. Developmental neurotoxicity, cardiac birth defects, low birth weight, increased lifetime vulnerability. You program these babies to chronic disease. Not all of them, but there's a statistical increased chance of exposed babies to develop obesity, type 2 diabetes, respiratory disease, cardiovascular disease, Alzheimer's, Parkinson's, and some cancers. That's in the medical literature. So there was actually a review of the literature done by the Canadian Environmental Law Association, Ontario College of Family Physicians, the Environmental Health Institute of Canada, What it says there, early exposures to hazardous chemicals / pollution and associations with chronic disease, a scoping review. You can download this and read it. So, big shock. So we left the conference, my wife and I, there's us. We didn't walk home, but we went on a walk on the beach after we got to our place. And that was the message. We need to listen to the Canaries. They're telling us something. You guys aren't just weird. You're not just something wrong with you because you're sensitive. You're giving a message to the rest of humanity that they should be looking at chemicals. What else are the Canaries warning us about? Well, chronic diseases, well, that's the Americans. Chronic diseases in the US going up. And there are many reasons. A major one is environmental. Yeah, the Americans are even worse than us. There's more obesity. They smoke cigarettes maybe more. They exercise less. We're not far behind them. They're just worse than we are. We're not great in our lifestyle either. And clearly, those things and many other things. Poverty contributes to chronic disease. There's many things that contribute to chronic disease. But environmental chemical exposures is another one. So this I had to bring up because if there's anybody going, okay, he's talking about these things in the medical literature, where is it? And you're probably aware because you had to come through that door that I wrote this book. And this is just a different version of the book. What the difference is there's 30 more pages on the actual effects on chronic disease, but there's over 2,000 citations in the medical literature. So the Ontario College of Family Physicians did 5 main Pro-C workshops, and how that developed was I got a message across my screen one day in an email about various main Pro-C programs being given by the college, and I sent a rant off to my fellow members of the Environmental Health Committee. Well, why don't we have any? And they said, because we never wrote any, John. And so the next thing you know, I was in charge of the committee to have to create them and write them. Main Pro-C are the programs that you need to maintain fellowship in the Canadian College of Family Physicians. So we've created 5 now. These are special workshops doctors pay to attend to try and get study hours. So basically, besides climate change and health impacts, we're also teaching doctors depending on what point in life. Number 4 is one that you're probably going to be very happy to hear that we actually have a program to teach physicians, but we don't make them take it. They have to be interested in it and want to take it. Chronic pain, fatigue, and chemical intolerance linked to environmental exposures, how to assess these patients in the office, how to manage them. And the 5th one, common chronic illnesses and the environment. Last year, the Ministry of Health of the Province of Ontario funded a business case proposal to build a Centre of Excellence in Environmental Medicine in Ontario. And there are many different parts to it. I was actually the writer of the part called Academic and Clinical Perspectives. It looked at these 3 chronic complex conditions, and we're trying to design a Center of Excellence which will be able to not just try and understand what's the matter with patients with these entities, but also to try and figure out how to treat you. Because we really don't know how. We give you the advice of stay away from chemicals. There's many different things that are offered. There's people who try all kinds of things. There's integrative medicine. There's nutritional therapies. There's many different things that are offered. The bottom line is, as you've all struggled with this, is we really don't know. We have to figure out what to do. And we hope to get funding to be able to do that. So, who supported this proposal? Ontario College of Family Physicians, University of Toronto, Department of Family and Community Medicine, the Dalla Lana School of Public Health. They're in, and we now have funding to teach 6 fellows in the next 3 years a fellowship in environmental medicine after they finish their training and certification in family medicine. We now have that funding. That's new. Toronto Central LHIN. What a LHIN is a local health insurance network, and the way the Ontario Ministry works is they give out the billions of dollars to different areas. So the Toronto Central Inn is the area that's responsible for the budget for the entire central part of Toronto. This is all the money goes to hospice. It's multi-billion dollars. They're actually starting to feed us money to try and help us to start setting up this Center of Excellence. We'll see where it goes. Unfortunately, we have an election coming in Ontario, so unfortunately, politics plays a role in everything. But it's starting. Canadian Institute for Health Research. This is the major funding for all research in Canada. People who want to apply for research try and apply to these guys. They have offered to fund the first meeting of international experts so that we can start looking together at what's wrong with you and how can we start trying to figure out how to fix it. So we can start prioritizing what's the most important thing to look at and how to try and study it. So when the announcement came that the fellowships were to be given, which was about 2 weeks ago, Dr. Lynn Wilson is the professor and chair of the Department of Family Medicine. She said, and I think the main thing to see here is new environmental health fellowship is an exciting training opportunity. So if any of you are looking at that in the future, consider this. Deb Matthews, we got to get the politician involved. She's the Minister of Health and Long-Term Care. And she said there's a growing recognition that our environment and our health are connected. Well, duh, but that's great. You know, the politicians are starting to hear it. And we need to develop greater understanding of the links. We need to provide better care for chronic complex illnesses. And this is what we had to say. We were just thrilled with the ministry's funding. It's a missing element in medical education. Medical students are taught to take a history. The first thing you learn is take a good history, listen to your patient. Medical students are not taught to take an environmental exposure history. We are honored to train more physicians to integrate the environment to protect personal and public health. That was our quote. So why only family physicians? Well, we see people who get sick when there's a heat wave. We're treating heat exhaustion and heat stroke. Family docs that emerge. That's what we're seeing. We're the ones that see people in early pregnancies and early childhood, the healthy ones. Chronic pain, fatigue, and chemical intolerance, they always end up back in the family doctor's office. There was a study done in 2012 on fibromyalgia, and they looked at doctors in Ontario who are rheumatologists. And more than 50% of them didn't want to treat fibromyalgia, even though it's the rheumatologists that come up with the criteria for the diagnosis. We see multiple chronic illnesses in the environment. And if any of you have multiple illnesses, here's your experience. You go to your asthma specialist, and he doesn't want to talk about your bowels. If you're having a problem with your bowels, he sends you to the gastroenterologist. It's like the parts don't talk to each other, so neither do the doctors. Why doesn't every physician know about the effect of the environmental health? Everyone here, and I was just making slides before this talk, there may be people, specialties that I've missed here, but all these specialties should be learning about environmental health. Time for a new story. So several billion years ago, the universe was formed. This is a very long story. I'm going to shorten it. So you can see at the beginning of the small part of that big blue sea in the middle is the beginning of the universe, and how we went from single cells to dinosaurs, etc. And the dark blue at the bottom is when primates came. And at the very bottom is 10,000 years ago when we stopped being hunter-gatherers. Many of us did. There's still some around even today. But generally, we developed from being hunter-gatherers to become farmers. And that enabled us to stop constantly looking for food and survival and to start building civilizations. But this is where we lived. And this is how we had evolved over billions of years. We lived like that. Then about 10,000 years ago, we started to form civilizations. A lot of them are gone. Fast forward 10,000 years. World War II is now over. 1945. That's my mother and my father. My father was a soldier in the war, met my mother. And one day I asked him, so Dad, was I born premature? God knows why I asked that question. And he went, let's see, your mother got off the boat, and he started counting his fingers. He said, nope, right on time. Oh, it grossed me right out. But that was me 2 years later. Future doctor, 1948. And this is my grandson. I had to work it in somehow. Jaden Molot, future Ottawa Senators NHL superstar, with apologies from last year. And I'd like to thank all you for being here tonight, because there's a big game on and we're all missing it. So 2 generations, 60 years, approximately 80,000 new synthetic chemicals have been introduced to the environment. 1,500 new chemicals are introduced every year, and the majority of them are not adequately tested for their impacts on human health, or their impacts on children, or their impacts on the developing fetus. Presently, more than 3,000 of them are high production volume, means that more than 1 million pounds per year are being produced into the environment. Basic toxicity information is available for less than 50% of these high production volume ones, and only 20% for developmental toxicity. Just keep throwing it out there. It's safe. We have different rules. We're allowed to do these things according to the laws that we have. We're not allowed to do that with a drug, but we're allowed to do it with the air. There's a large number of chemicals in air, food, and water. You know this stuff. Urban air is more polluted than rural air. More than 80% of Canadians live in an urban environment. Pollution consists of particulate matter, little tiny, tiny particles that you cannot see. For example, do you ever wonder where the rubber on your tires went when it went bald? It's in the air. Burning of fossil fuels, gas, oil, a major, major source of tiny, tiny, tiny particles in the air. Indoor air, though, is more polluted than outdoor air with chemicals. Comes as a surprise to many people. And we spend 90% of our time indoors. Persistent organic pollutants are accumulating in the food chain. These are chemicals that don't break down. A lot of them are now being banned because we realize, oh my God, we're making a mess that we can't clean up. But they're persistent. They're still there. We're seeing PCBs, which were banned 25 years ago. They're in our children. They're up in the Inuit because they don't go away. They just spread around the planet. We sit at the top of the food chain. These things get into the water. They get into the food chain. We sit at the top of the food chain almost always. And so we're accumulating these things as they accumulate up the chain. Our drinking water is polluted too. It's just not as bad. So what do you need to know? We're regularly exposed to hazardous chemicals, and we carry many of them in our bodies. They're stored in fat, blood, bone, sperm, ovaries, and breast milk, just to name a few. Females have higher levels. More than 90% of our pollutant exposures come from sources that are close to us, like in this room. And they're within our control, but we're not aware. And most of them are not regulated. There's no rules. So it's air, food, water. It's what we're doing to our planet. The pollution comes from many, many different sources. So this is just a map that came from Environment Canada, and this is a map of sources of pollution that's regulated. So you can look at Alberta, and it's clearly not as populated as we are down here in the St. Lawrence Valley, but it's regulated. So when you look at this is ozone. Ozone comes from nitrous oxides in the air, plus volatile organic compounds, which are chemicals in the air, and heat. So especially in the summer, you get a lot of ozone. And the darker color that, it's not very clear, but clear on my screen, the brownish color around the Great Lakes, there's much more ozone than there is with the rest of Canada. So this probably looks familiar. Winter just ended last week. But if you watch the weather channels and what's going to happen in the next couple of days, you always saw this. The weather systems moving up from the middle of the United States, up towards the Great Lakes, up the valley, getting everybody along the way. When you look at this, what this is coal-fired electricity. So this is where coal burning takes place. Ontario, by the way, just closed their last source of coal burning. But they're not closing them in the States. And where it is the most polluted is the dark brown. So if you look under Lake Erie and Lake Michigan, you see the Ohio Valley. That's where a lot of the coal-fired source of electricity is going on, polluting the environment, moving up that weather system. These are the regional prevailing winds. It's moving everything from the United States, so they have cross-border pollution. That's where we all live. And that pink color is more polluted. Those are volatile organic compounds, chemicals. They're much more plentiful indoors than outdoors. So that's a nice picture of downtown Montreal from the mountain. Average particulate matter. Particulate matter is the little particles I talked about. So how small are they? So you see that 2.5. That's really small. The human eye can see 50 microns, the head of a pin. If your eyes are really good, you can see the head of a pin. That's 50 microns. So it gets smaller and smaller than that. We can't see it. And they get down to 2.5 and say there's a strong association with illness. So look at Sarnia. It's the same as New York. So how did that happen? Because there's a lot of stuff coming from the United States from that coal burning. Look at Montreal. Second place. Not bad in the NHL, but this sucks. Toronto. Much bigger population, not as polluted. Not as polluted because less stuff is being gathered. We're blowing our pollution in Toronto up to you guys. Vancouver, a little bit lower. Look at Paris, 22.7. Mexico City, Beijing, Olympic time. That's why they shut down the traffic during the Olympics, so the athletes could compete full value. Montreal is rated the second worst city in Canada for air pollution after Sarnia. It contributes to approximately 1,500 deaths each year in Montreal. 30% of the pollution comes from Ontario and the USA. It's worse than Toronto, despite Toronto having a more population. And the bad news is separation isn't going to help you. So, World Health Organization. This is just mapping death from pollution. The darker the color, the worse it is. What's interesting is if you look at Europe, it's better than North America, and you wonder why. Well, actually, a lot of the countries have better laws for contamination than we do. But the stuff is going around, the weather systems don't just stop as they get to the ocean. There seems to be a constant move with the jet stream. We, in North America, get a fair amount of pollution that comes from China. The average number of deaths, that's just comparing also hot weather because of global warming, but you could start to see there's a lot of deaths linked here to the environment. If there was an announcement, a newspaper article tomorrow, and the headline said, 1,082 people dead in Montreal, but you read that, that's going on, that went on in 2007, it's not much better now. I will tell you that the statistics, at least in Ontario, because that's all I know, have improved over the last 10 years. They're not perfectly fine. They're not zero, but they've improved so much, and so is the air quality. $1.6 billion in economic loss each year from air pollution and heat from Montreal and Toronto. That's amazing. So when people are saying, we have to be worried about jobs, we have to be worried about the economy. Well, if the economy would probably be a lot better if we stopped making people sick and dead. Deaths linked to air pollution in 2012. This is World Health Organization. 7 million people died on the planet. 1 in 8 of total deaths worldwide can be linked somehow to the environment. More than doubles previous estimates. Air pollution is now the world's largest single environmental health risk. Why are we dying from air pollution? What happens to us if we don't die? Do we stay perfectly healthy? Is it black and white? Bad pun. So let's look at this. Look at that little house right in the middle at the bottom. Nice little 2-story clapboard. It's a lovely little house. Would you live there? Would you live here? This is much cleaner. This is early spring, the yards are clean, lovely little houses. Look at that green fence between the two houses. You know what's behind the green fence? Highway 401. There's the green fence. Now this is an aerial view of the Don Valley Parkway and the 401. I tell you this because the Don Valley Parkway has about 125,000 cars per day, and the 401, it turns out, is the busiest highway in central Toronto. It's the busiest highway in North America, has close to 450,000 cars average per day. So when you look at those two crisscrossing, and you know, any of you doctors here, do you actually know where your patients live? But I put this picture up to show you this. There was a study produced 12 years ago in The Lancet. The Lancet is one of the most respected medical journals in the world. They followed 5,000 people for about 8 years, age 55 to 69, just to see what happened to them. Those who were living near a major road. Double the risk for death from cardiopulmonary causes. That's all they looked at. They didn't look at other diseases, just double the risk. And now we started people saying, oh my God, there's a problem here. So now we know about outdoor pollution links in adults. What do we see? All of these things. That's adults. This is what we see in kids. All of these things, they're all linked to outdoor pollution. Pregnancy, we see low birth weight. There's some inconsistency in the literature about preterm birth and stillbirth. Not clear. Maybe not a link. What are the major outdoor pollutants? Well, one is ozone. So ozone is O3, and those of you who have any chemistry background at all, oxygen is O2. So what's O3? Well, it's got an extra oxygen atom stuck on it. It's not very stable, so that extra oxygen atom tends to break off and go and attach to other things. So it's quite toxic. And it's, I showed you earlier, it comes from volatile organic compounds, nitrous oxides, and especially in the summer with heat. And the other most major one is particulate matter. Those little tiny little particles. There's other things, nitrous oxides, sulfur oxides, carbon monoxide. The exposure to these things is constant unless you live out in the country. The influence could be additive, could be synergistic. And what that basically means is it multiplies. So the 1 plus 1 becomes 3. Each one can make the other one worse. So when we look at particulate matter, little particles, they're not all the same. It's like going into a room where there's 10 terrorists or going into a room where there's 10 people who want to give you money. Which room are you going to go into? So they're not exactly the same. So they're diverse. But the ones that we're looking at, they're byproducts of burning of fossil fuels. There's 3 categories, and they're really based on size. The really ultra-fine ones they don't just get into the lungs. They get into the bloodstream, and they get inside cells. This is just to give you an idea that 0.1 on your left, that's the size of a virus. Those are ultrafine particles. You're breathing them in now as we speak, and you're certainly breathing them outside too. So just thought I'd make that point. Size matters. The smallest particulate matter can even get into and through the alveoli. The alveoli is the little sacs where the oxygen and carbon dioxide take place. This just happens to be, I thought you'd find this interesting. This is a study actually done in Mexico City, which clearly is a lot more polluted than it is here. But they had the unfortunate opportunity to do autopsies of young adults who died by accident or by suicide. And they looked inside the brain, and these are pathology specimens of the olfactory nerve, the nerve for the sense of smell, and a part of the brain called the limbic system, which is in the middle of the brain where the nerve for the sense of smell goes. And you could find those particulate matters inside those neurons. So they're not just going into the lungs and getting breathed in. We actually can transport them directly into our brain through the olfactory nerve. It's called translocation. So this is looking at air pollution and quality of life. We have really good statistics in Canada for death, and accurate statistics, right? For death, you have to sign a form when you die. Hospital admissions, accurate statistics. And so we can watch these statistics go up and down at the same time as air pollution quality goes up and down. So the top of the pyramid is very accurate that we see a definite relationship with mortality, hospital admissions, emergency room physicians. You see less about how many more people took Tylenol on a bad air day because they had a migraine or used their inhaler. These statistics are harder to gather, maybe less accurate. The American Heart Association has established a link between air pollution exposure and particulate matter with cardiovascular morbidity and mortality. Morbidity is illness. Urban pollution exposure enhances the risk of developing cardiovascular disease. This comes from the American Heart Association. It increases atherosclerosis, hardening of the arteries. It increases blood pressure. Urban living reduces long-term chances of surviving a stroke. If you have a stroke and you get out of the hospital, your chances of surviving a year are reduced if you live in an urban environment. Overall mortality is higher in most polluted cities. Living close to traffic increases the risk for a heart attack, doubles the risk for death. And for whatever reason, we'll get into a bit later, women are at greater risk. Allergy and autoimmune diseases. Prevalence of food allergy in children under the age of 18 increased by 18% from 1997 to 2007. Numbers are going up. When I was a kid, I was weird because I was allergic to nuts. Well, that's weird. But I was a kid a long time ago. Now it's like if your kids don't have allergies, something wrong with your child raising because it's so common. Prevalence of peanut allergy is doubled. Anaphylactic reactions, those are the worst, those are the life-threatening types of chemical reactions. People carry things like EpiPens to save their lives so they can buy time to get to the hospital. These reactions have increased. The increase of allergies impacting the respiratory system is related to pollution exposure. The prevalence of autoimmune disorders. Autoimmune disorders are disorders where your immune system doesn't recognize that you're normal as part of your environment, and it turns on you and starts attacking something in your body. An example, rheumatoid arthritis. Another one, multiple sclerosis. The immune system is involved in attacking cells. The increase of autoimmune disorders is associated with environmental exposures like solvents. Asthma, sharp increase in the global prevalence, meaning there's more and more people with asthma, especially in children. 300 million people worldwide currently have asthma, and it goes up by 50% every decade. Pollution influences the development of asthma. 37% of teenagers are affected by asthma. That's ridiculous. Air pollution exposure is linked to central nervous system. Children, there's a deficit in neuropsychological development. There's evidence for behavioral deficits, and we're starting to find a link with autism. And I have to tell you, a link does not mean cause. Link means we see an association, and it seems to be influencing the likelihood of. Adults, again, cognitive decline in the elderly, linked to exposures. In particular, Alzheimer's and Parkinson's. And Parkinson's, we're all familiar with Parkinson's, what it kind of looks like. There's a tremor involved. Many patients with Parkinson's develop cognitive impairment and dementia. Proximity to a major road, which I talked about before. Well, what does that mean? Depends on the study. Could be 50 meters, could be 500 meters. The average one seemed to be about 300 meters. What's a major roadway? 10,000 cars per 24 hours. And so this is just for Montreal. I found these statistics, 167,000 cars in 24 hours near Ville-Marie Expressway. If you live 501 meters away, are you safe? And these are the things that we're finding associated with proximity to major roadway. You're more likely to get these kinds of conditions if you live close. So those who are not aware, Canada has an air quality health index. And basically what it means is they look at the various parameters in the air and maybe a statistical likelihood that it's not good for you. It's an attempt to start teaching people to be aware. If you look closely at it, this is what it says. If you're at risk, and we see the air quality health index is 4 to 6, it says, consider reducing or rescheduling strenuous activities outdoors. No need to if you're not at risk. You go into very, very high risk, and you can look down at the bottom on your right. And if you're just a general healthy population, and the number is really, really high, and they say, well, maybe you should reduce or reschedule strenuous activities outdoors. Notice it doesn't tell you what else to do. Basically what they're telling you is, try not to breathe harder, because you're just taking in more stuff. That's all we have. It's a precautionary principle. There's a couple of papers that were reviewed They looked, for example, at asthmatics in London, England. And those of you who know London, there's a place called Hyde Park in the middle of the city. Excuse me, and there's a famous street called Oxford. And he just compared people who had asthma if they went for a walk in Hyde Park versus if they went for a walk on Oxford Street. And it was a significant change. So we know logically and with some evidence that you shouldn't be strenuous in bad air days. That's all we have. But how many bad air days do you have to have? And what really is bad air, where we're able to see more people likely to die or go to the hospital? What about living in it for the next 50 years? There's no advice to stay indoors because it's worse indoors. As indoor air quality. That's the way it should look. We should have beautiful clean air, and it should be just as beautiful and clean indoors. We spend 90% of our time indoors. What's acceptable indoor air quality? This is what the literature says. It doesn't contain harmful concentration of contaminants. We just don't know what the harmful concentrations are. So they use this. If 80% of the building occupants, we're talking about a large office building, apartment buildings, and so on. If 80% of building occupants do not express dissatisfaction with how they feel in that environment, the air is okay. That's acceptable indoor air quality. So, nice house. Would you buy this house without getting a home inspection? What would your lawyer tell you? Well, the Ontario Association of Home Inspectors, standards of practice is on their website in Ontario. I can't tell you about here, but I assume it's similar. They are not required to determine indoor air quality. They're not required to identify the presence of hazards like toxins and carcinogens and contaminants in the air. It's not their job to do so. And they don't assess the effectiveness of any system that you might install to clean it. They may look at it and tell you whether it's dirty. 90% of our time spent indoors. It's influenced by outdoor air quality. Where's your house? The building envelope filters and reduces exposures to the outdoor pollutants. It doesn't get rid of them. It just filters them out somewhat. When the energy crisis came in the 70s, which I remember, they advised everybody, tighten up your homes. It costs money to heat, costs money to cool. Tighten them up. So it kind of helped to keep some of the pollutants outside, but it kept the pollutants inside. Ventilation was reduced. The economics changed back then. The good old days of the 60s and 70s economically are gone. So we have cheaper materials that we manufacture. We don't use oak anymore. And they chemically gas off. There's an increased amount of chemical cleaners, detergents, fragrances, etc. We use them more and more. So we're going from the frying pan to the fire. So when you look at air quality in your home, outdoor air contains all kinds of things. We put in more VOCs indoors from perfumes, hairsprays, cosmetics, air fresheners, carpeting, draperies, furniture, upholstery, paint, more from electronic equipment, from cleaning products and insecticides, unvented gas stoves. Gas stoves are an issue because people who really like to cook well, enjoy cooking, tell me over and over again, you can do better with a gas stove. So here's my answer. If you really like using a gas stove, only use it on high. Obviously, you're not going to cook very well doing that. Why do you only cook it on high? Because it burns off the gas better than when it's down low and it's only partly burnt and therefore gives more pollutants into the indoor air environment. So we use air conditioners and things like that, but they don't seem to remove any of these things. We do have some filters, but generally speaking, in the average home, we don't filter the air that gets recycled. There's the same thing at work. VOCs from electronic equipment, VOCs from carpeting, furniture, upholstery, paint. VOCs and odors from cleaning products. From the fine particulate matter, it comes from things like photocopiers. These are all things that, electronic equipment, they're all things that keep adding more and more things to the air, and we just keep recycling it. Just keep recycling it. Just keep recycling it. Sources of volatile organic compounds. These are the chemicals in indoor air. construction materials, fabrics. It goes on and on and on. These are all the sources for it. Now, things like paints don't gas off forever. But if you're constantly working in if you're working in an environment that's constantly renovating, even if it's not on your floor, it's constantly just adding to the mix. So you can see there's just so many. Fragrances need a whole slide unto themselves. There's 1,300 different chemicals in fragrances. So these are all the different things that are fragrances, not just perfume. There's deodorants, soaps, fabric softeners, air fresheners. The term unscented, this is the law, this is the way it's written so far, means you can't smell it. So you can mask chemicals with other chemicals, it's just more chemicals. So unscented is certainly better for those of you whose sense of smell is really sensitive. But it's not necessarily meaning that you've reduced the number of chemicals. And they're proprietary. The fragrance people do not have to tell you what they use. They're protected by law, and they contribute both volatile organic compounds and particulate matter to the indoor air. There's usually 50 different volatile organic compounds identified in average perfumes that are used today. Everybody knows this. No sense makes good sense, but I'm preaching to the choir, at least mostly here. So, would you set your chair on fire? The reason I put this in there is because all the fabrics in your home, including your insulation, have fire retardants in them. All the fabrics in your home, your clothing, has stain repellents in them. And they're in you. Flame retardants, stain repellents, plasticizers, biocides, these are all called semi-volatile organic compounds. It means they gas off more slowly. There's many different sources for them. They gas off more slowly. And they're a little bit different. They don't vaporize and disappear. They tend to want to go back into a solid phase again. So when they find something solid to stick to, they stick to it. So these chemicals are in your house dust. They're in the particles in the air. They attach to them, and that's how they get in your body. Lots of sources. These are the sources again. US EPA, more than 1,000 semi-volatile organic compounds are listed as high production volume chemicals at more than 1 million pounds per year. Over 100 were detected in the US CDC's biomonitoring program, which I'll talk about in a minute. Semi-volatile organic compounds, they don't disappear that quickly. They're persistent, at least sometimes for years. Exposures can occur by inhalation, ingestion. Ingestion, well, if there's stuff going in the air and it seems to be attracted here, and I'm cooking my food on here, it's a small exposure, but there's nothing you can do about it. You can keep trying to wipe it if you want, but it's just there. And it can also get in through the skin. They stick to solid particles, as I mentioned. So indoor air quality is considered 4 to 7 times worse than outdoor air, and this is why. All of these volatile organic compounds, semi-volatile organic compounds, there's hundreds of them that have been identified. There's few health-based guidelines for VOCs in the indoor air. In the non-industrial workplace, in the industrial workplace, they test the chemical. There's no guidelines at all for semi-volatile organic compounds. There's no guidelines in the combinations of all of these chemicals. And as I mentioned, these chemicals are higher indoors. Particulate matter is lower indoors than outdoors, but we have different kinds of particulate matter indoors. For example, our particulate matter indoors have more semi-volatile organic compounds than the ones outdoors do. So semi-volatile organic compounds are absorbed, stuck to those very small chemicals getting into your body. Ozone's reduced indoors, but when it goes up outdoors, it also goes indoors. And so the little extra oxygen atom in there is breaking off and getting into other chemicals, making them more toxic. That's what your air looks like when the sun comes through the window. So we look at particulate matter. Some of it's natural. Some of it's from human activity. Some of it's from pollutants. Natural stuff. This is just soil, human skin, animal dander, dust mite droppings, gross as it sounds. Particles from other insects, cockroach. Hopefully you don't have any cockroaches in your house. Some people did or may have. And the particles from those insects as they died. It's in dust. Mold is in dust. It's not just the spores. Allergists look at spores and say, well, you can become allergic to the spores. But there's other parts of the mold that end up in the dust too. It's called the fungal mass, the components of the cell wall. I got to tell you that those components are not highly allergenic. They don't cause a lot of allergy. But they're also described as pro-inflammatory. They're contributing to an inflammatory process that's hard for us to prove clinically. Human activities. Just moving around the house stirs it up. Cooking makes particulate matter. Gas appliances, particulate matter. Food particles, tobacco smoke if you smoke or your neighbor smokes. Tobacco smoke is most significant thing if there's smoking in the house. It's hard to measure the other contaminants. Candles. Burning candles, you're just burning wax paraffin made from oil products. If they're scented, throw in a few more chemicals. Fabric fibers, it's all part of it. So there's a soup. How do you make indoor soup? Well, you add contents constantly and you stir continuously. This is the menu. See, these ladies are making soup. There's all the different contents that we have. Just keep stirring. And you get the mixing in the air. We produce particulate matter. Chemicals get stuck to the particulate matter. They get oxidized, is the term used for what happens with the ozone. And there's this thing called surface chemistry, which I never heard about when I was in med school or in high school and so on. We all know that if you took high school chemistry at all, you put substance A and substance B in a test tube, nothing happened. You put it over the Bunsen burner and it turned color or it blew up, depending whether you made a mistake or not. But heat would act as a catalyst. And we now know that surfaces act as a catalyst, that they attract chemicals. And when the chemicals come together, they're more likely to interact. So this is just kind of a picture that I found on the internet. So you got a couple of red and black balls stuck together, and they get attracted to the surface, and they come off looking differently than when they entered. Nice house. Don't spill the wine. Be careful of the stain repellents. There's some candles burning. It's a beautiful looking place, but you start looking around. When you get home and you start looking around in your home, look at all the sources of things that are going on inside your own house. Sorry, that was just thought how to treat people who have problems with indoor air quality. And also we need to look at food. Too many people are aware of calories. Nobody's looking at the contents. Nobody's looking at what's in the stuff that they're buying. You are what you eat. Think before you eat. Think about what's in there. Think about the sources. This came out from the Environmental Working Group. It's a private organization that's trying to make a lot of noise and doing a good job at it, at advising people to watch out specifically for pesticides in this particular slide. They're talking about the dirty dozen. But these are the top 12 sources of pesticides that may be in your body as we speak. I just throw up this slide just to show you that what they're measuring here, if you look at the top column on your left, the second from your left, average level of PBDEs, these are flame retardants. The average level of flame retardants found in fish. So, you know, it's good to know your fish won't spontaneously combust. This is a silly joke. But it's giving even the levels are small, but they're not zero. This stuff is being spread around the planet constantly. So, skeptics in the audience, so what? So I got an idea for an experiment. Let's pick 100 different medications from the pharmacist, capsules, open them all up, and then mix it up and just take a small amount of those 200 chemicals and put them in one capsule. And take it every day, even if you're pregnant. And give it to your children, too. Anybody want to volunteer for this experiment? And the point is, the experiment already exists. So this is a report from the Centers of Disease Control. They've now done 4 reports, each report looking at more chemicals than the previous report that are found in humans. So looking at, this is called biomonitoring. It's just looking at what's in there. This is going on around the world now. This is government databases. U.S. Environmental Protection Agency looking at stuff in fat, U.S. Centers of Disease Control have done those 4 surveys. Report on human biomonitoring of environmental chemicals in Canada by Health Canada. Independent groups. Environmental Defense Fund, these guys took a bunch of reasonably famous people a few years ago and said, would you volunteer for us to measure chemicals? Trying to make a noise. Environmental Working Group that I mentioned, talking about pesticides, they've done their own biomonitoring. So here's one, because this came out many years ago. Most of the chemicals are stored in fat, so they actually looked at fat. It's kind of hard to get people to volunteer for biopsying fat because it really hurts. So we now look in blood, which is a reflection of, but not as high as what you see in fat. Over 700 chemical substances were found. A lot of them are big words, so I won't try and pronounce them, but this is kind of stuff that they're finding in fat. So, National Health and Nutrition Examination Survey. First report measured 27 chemicals. I said to you they've done 4, so the last one they measured 212 chemicals. 99% of the population contains fire retardants, so none of us are going to go up in flames either. 90% of us contain plastics. Most people contain heat-resistant non-stick coatings, stain-resistant chemicals, industrial chemicals, heavy metals. So this is what Health Canada found. 91 chemicals measured. This is what they found. Look at them all. They're in us. And they shouldn't really be there. Are they causing a problem? Seems to be. Cotinine, I just bring that up. Cotinine is the way we measure exposure to tobacco smoke. It has a half-life of 18 to 20 hours. So what that means is if cotinine, if you've been exposed to tobacco smoke and the cotinine is in you, half of it will be gone in 20 hours. That's how we measure the degradation in animals and humans. What's interesting is the vast majority of people don't smoke. But next time you walk out of a building and the people are smoking 9 meters from the door, or whatever the sign says, you're getting exposed. When your colleagues at work go outside and smoke, if you're standing beside them, you get secondhand smoke. Well, we now call there's something called third-hand smoke, because they come back into the environment. They're not smoking anymore, but you can probably smell them. Where does that go? It goes into the environment. So majority of humans, you can measure cotinine. Environmental Defense Fund, Toxic Nation Report. They tested 11 volunteers, and they found that the average in chemicals in those volunteers had 44 out of 88 that they tested. There's again the big list. Everybody's polluted. The average North American has approximately 200 things in there that really aren't normal. There's the list. Same list. Some detoxify slowly. Some detoxify quickly, but we keep putting them in there. Plastics, for example, does not stay very long in the body. The vast majority of people have plastics in them because we keep eating them. They're absorbed by fats and oils. We find them in fat, as I mentioned, and there's a lot of oils in your brain, by the way. Environmental Working Group did 2 small studies of 10 newborn babies in each study. So it's not statistically valid. But here's what they found. 287 chemicals found in cord blood. That's taking blood out of the cord when the baby's born. That's the exposure. That was done in 2005. 2009, they did another one. 232 chemicals found in cord blood. There are 400 publications in Medline. Medline is the search engine for the medical literature around the world. It gives the abstracts of all the studies that are published in peer-reviewed journals. 400 publications talking about prenatal contamination. So what? Chemical industry's response to the 4th report by the US CDC. This was their response. And I put in red there. Like the previous 3 studies, the levels remain low. That's reassuring. Are you feeling reassured? What does the evidence actually say? So, changes in health in the last 60 years? Birth deformities, reproductive difficulties, neurological abnormalities, cancers of certain types, cardiorespiratory morbidity and mortality going up, more asthma, obesity and diabetes. And you wonder what that's got to do with the environment. I'll tell you in a minute. There are emerging conditions. I don't know why they keep calling them emerging. But, they look familiar, obviously, to you all. They call them emerging conditions. Is any of this due to environmental exposures? So you need to understand balance. We use in the medical world, we use the word homeostasis. Things are in balance. Go to the doctor, he checks your blood pressure. It's great, 120 over 80, no problem. You go back in 6 months, check your blood pressure in, 120 over 80, perfectly stable. So stability is this. That's stable. But I'm actually holding my arm up against gravity, and I go, oh, no, it's starting to move. But if it's really, really steady, it looks like everything is stable. But there's a whole bunch of things going on to keep my arm from moving, and I'm not doing a very good job right now. That's balance. Pretty neat. I know next time I'm at the beach, I'm going to try and do this. Homeostasis requires constant work to maintain balance. Can anybody here do this? That's really hard. How about that? Not moving. It's magnificent. That's a great picture. I couldn't wait to put that on a slide to see what it would look like in the dark. It's a great looking picture. But imagine the homeostasis, the work required to maintain balance. Balance in the humans is on all kinds of levels. Cells, tissues, organs, systems, all of these things need to work together in balance for us to be healthy, for us to be able to run like in this picture. All of the systems communicate with each other. They actually do talk to each other. And it requires this communication. And that's on an atom level, a molecule level. You get all the way up here and so you look around at the people that are sitting beside you. Do you see 3 trillion cells? No, that's what's there. Do you see what those cells are doing? Do you see how the cells are staying alive? Do you see the oxygen going in and the sugar going in and the energy being produced? No, you don't see it, but that's all going on. And when you are sitting here, whether you're getting angry at me and your brain is getting stimulated, or whether you're just getting antsy and you want to get up and walk around, all of these things are going on constantly, and they're all talking to each other. The rhythm of the body, the melody of the mind, and the harmony of the soul create the symphony of life. That's yoga, but it's true. Man must live in harmony with his environment. That's beautiful. We live here. It's part of what we are. We must be able to adapt to change. So, that plant did. I had fun making that slide. We must be able to adapt to change. All kinds of changes occurring. Can you handle one side or the other just by walking across that bridge? Well, large external fluctuations of what's going on outdoors or any part of our environment. When you get down in a cell level, there's little small internal fluctuations going on. This is all going on constantly during your entire life from the moment you are conceived to the moment you die. So I just put this in here because I figured I talk too much. And maybe you might all want to just get up and take a minute to stand up and stretch. Don't do that because, don't do this at home. Just stand up and stretch just because I got more to go. Suck in all that fresh air. Get stimulated. Okay, party's over. Go back to the learning objectives, why I'm actually here. And it was to understand the biology of chemical sensitivities and why they are canaries. There's actually a reason why I told you everything that I told you, but I have to tell you another story. So these are actually pictures to try and demonstrate the developing brain, how the brain has changed not just in size, but what the brain is actually, how it's constructed. So this is the evolutionary design brain. This is ours. So what we have that separates from all the other animals is the blue part. It's called the cortex. All the human things that we can do, me standing up here talking, you actually hopefully understanding what I'm saying, this is all human cortex. The green part in the middle is called the limbic system. Remember that because we're going to talk about it some more. But it's the blue part that makes us human. The brain reads the environment. And it does so from the limbic system. The brain stem is at the top of your spinal cord. It keeps you alive. It is the most primitive part of the brain. It tells your heart to beat, your lungs to breathe. If you break your neck or someone hangs you, they break the brain stem, you die. The 5 senses that we have, vision, touch, etc., they all go to the limbic system. So all animals feel what's going on in their environment. They read the environment via the limbic system. There's actually a 6th sense, which is the immune system. We're not really aware of what the immune system is doing, but it's reading the environment, looking at molecular structures, and it's talking to the limbic system too. That's the limbic system. Any medical students in here, there's some big words that you guys should know by now. The purpose of the limbic system is survival, adaptation to the environment. That's what it's for. The limbic system reads the environment. One source is prefrontal cortex. If I have annoyed you, and you get a stress response, so your prefrontal cortex, the human part of you is saying, this guy's not shut up, he's boring, I can't wait to get out of here. The fact that you would feel stressed by this talk, the biology of stress, limbic system. Prefrontal cortex talks to the limbic system. Humans have the largest prefrontal cortex. Now look at light. Birds know to fly south in the winter. Bears sleep for the winter. There's a thing called seasonal affective disorder, which is if we don't have enough sunlight, some people can actually get biologically depressed and require either special light or antidepressant medication just to offset the effect of not enough sunlight. Sound. So these are 2 examples. Brahms, which is really beautiful and soothing, and with all due respect to those of you who may like rap, it irritates me. But it's reading the environment. Touch. Pain is a negative message. Many people here, from what I understand, have fibromyalgia. You have a constant negative message hitting on the limbic system. Sense of smell obviously is key. We're supposed to smell animals in heat, smell danger, find our way home. Using a sense of smell, we don't do that very well. We don't have a very powerful sense of smell anymore. But it's linked directly to the limbic system. Sense of taste, is this good for us or not? We read the environment to protect ourselves, and as I mentioned, the immune system does so too. So the role of the limbic system, survival and adaptation, that's where the stress response takes place. The autonomic nervous system, if it's too hot, if it's too cold, the brain has to read this and tell you what to do to respond to these things, as I mentioned before. Autonomic nervous system. Sleep. We go to sleep when it's dark. Then we invented fire, and then we even invented electric light. So we don't do this very well anymore. But that clock in your brain is linked to light. That's how it all evolved. Mood. Basic primitive moods like fear and anger. Limbic system. So, think of the difference between if you have a little puppy at home and you rub his tummy and it just feels so good. Try and do that to an alligator and see what happens, because he has no cortex at all. This is going to kill you. Cognition and memory. Very important for survival. If I threaten you with a gun right now, you will never forget this face. You need to focus and pay attention in order to learn and survive. And the beginning of cognition and short-term memory, before we refile it into long-term memory, is linked to the limbic system. Pain, negative touch, pain center, limbic system. Sense of smell, I've already gone through that, limbic system. It's also got a weak blood-brain barrier. And what that means is the brain is our most important organ. It sits in this little box, and we send blood up to it. But the cells of the blood vessels are very, very tightly linked to not let pollutants or any bad things through to try and protect the brain. It's called the blood-brain barrier. The weakest part of the blood-brain barrier is around the limbic system. And the reason is that it reads hormones and reads other things in the bloodstream. They have to be able to get in there. And the immune system actually, if your immune system responds to something, will actually provoke a stress response in the brain. So there's this thing called limbic system hypervigilance. Watch out. Be careful. Childhood trauma can teach us to be that way, and the biology of the brain does change it. Generalized anxiety does it. Chronic stress. Who here has not been chronically stressed at one point in their life and be hypervigilant to everything in the environment? Somebody drops a book and you jump from fear. This is what happens to our soldiers that come back from Afghanistan and so on. They got post-traumatic stress disorder. People with depression, they respond to any external stimulation from the environment in an exaggerated fashion. People with borderline personality, people with chronic pain. We measure limbic system hypervigilance We can measure this through tests, through scans, and so on. Chemical exposures do it too. And once you're stressed, you can interchange stresses and get an exaggerated response. So this is how to get people crazy. So actually I tell them, when I try to explain this to my patients, I tell them this. Most of my patients are middle-aged women. I say, I can make you crazy two ways. I can threaten to kill you with my gun, or I can marry you and do it more slowly. They all get it. Sensitization occurs from toxic or repeated exposures in susceptible individuals. Animal studies of limbic system sensitization. Here's where we start to get into, there is a model out there that makes sense about people becoming sensitive to chemicals. Repeated low-dose exposures to chemicals, which can cause changes in brain function at higher doses. This has been demonstrated. So the first studies were actually done by exposing rats and mice to chemicals which can cause seizures. But what they did is they exposed these animals to these chemicals below the level to stimulate a seizure. And nothing happened for a while, and then all of a sudden that same dose would provoke seizure. Aha, you ask. It accumulated in the brain, didn't it? So they chopped sacrificed the animals and looked to see, and there was no accumulation of these chemicals in the brain. It wasn't a toxic dose. It was sensitization. And what they found, obviously, is a lower threshold can provoke the symptoms. So there's an animal model, and they've been able to do this with fungicides, herbicides, insecticides, solvents, and formaldehyde. Animal models of chemical sensitivity. They took some rats that were genetically programmed to be sensitive to organophosphate pesticides. I don't know how they do this. Please don't ask. I don't understand. But they were able to do it, and they found that these rats were more easily sensitized to other chemicals, not related to those organophosphates. They showed hypersensitive receptors in the respiratory and gastrointestinal system. What does that mean? Cells receive messages from other cells. Hormones are messengers. They send messages to other cells. The cell has to receive the message by little pockmarks or whatever that the hormone or the chemical can get into and trigger off a response. It's called a receptor. It receives the message. It's on this surface of cells. And these rats had hypersensitive receptors in the respiratory system and the gastrointestinal system, similar to patients with chemical sensitivities, and you'll see that in a minute. Animals sensitized to a chemical are more easily sensitized to other chemically unrelated substances. So why are MCS people canaries? Here's one reason. The genotype for detoxification, the ability to break down things inside cells and get rid of them, is abnormal. Not in everyone, but statistically more likely to occur. There were two large studies done. The first one, 203 patients compared to controls. There's the citation. It was done at Women's College Hospital in Toronto. There's another one done, 521 patients. Total 724 patients were able to show there was an abnormal genotype for detoxification. This paper just came out last year. 330 patients with environmentally linked conditions. This is how they listed them. 156 people with MCS, 94 suspected MCS, and I don't recall why it was suspected, and 80 patients with fibromyalgia and chronic fatigue syndrome. And compared to 113 controls, they found an abnormal genotype for detoxification more likely. So now is another story. It's the story of cells. This is a cell. That's actually what they look like. The cell is the smallest unit of life. It needs to absorb oxygen. It needs to absorb food. It needs to convert oxygen and food into energy. It needs to have enough energy to perform its job, whatever it is. If it's a bone cell, it kind of hangs around, reads comics, doesn't do very much. If it's a neuron, for example, it needs a lot of energy. It never stops working. The cells need to communicate with others. It shouldn't be irritable or depressed. They're just like us. They need all of these things. They need to reproduce. They need to get rid of its waste products. So there's a natural system inside every cell to do all of these things. There's 3 trillion cells in the average human body, and 86 billion of them are in your brain. That's what a cell looks like under a microscope. You see all these different colored circles and funny looking things in there. That's a cell. They don't have organs to do all these things, so they have parts that we call organelles. So they have different jobs to do, and they work together as a team. It's a bunch of systems working together, and somehow that's life. And we have evolved from that. There's 3 trillion of those guys, all with subspecialties, making us survive and have the kind of life that we have. This is just an example if you could actually shrink down and look at what a cell looks like. You see all these different weird-looking things in there. That's a cell. I thought this picture was really cool. So the part that we really want to understand are these mitochondria. They're key. They're all key, but this one especially is key for the conversation. That's actually what they look like. They sort of look like caterpillars or cigars, and they've got all different parts to them and so on. Their job is to use the oxygen and the sugar and to produce energy. The energy packages, if any of you took high school biology, is ATP. That's their job. And they swim around the cell, and they give the energy to whatever parts of the cell demand it. So here's the story. The story is that several billion years ago, there used to be little bacteria swimming around in the ocean on their own. And as the world started to evolve and cells started to develop into other kinds of organisms, we started to get algae and plants. And these things fed off the carbon dioxide and produced oxygen. So the oxygen started going up in the atmosphere, and these little guys were going crazy because that's what they thrive off. And they became more and more plentiful, and the big cells came and ate them. And they figured out after a while that maybe they shouldn't eat them because they got this buzz of energy. And so they kept them enslaved and started to feed off the energy, and they got bigger and stronger and took over the world. Primitive cells don't have mitochondria. More advanced cells do. There's a reason I'm telling you this. But this is just interesting. They have their own DNA. And by the way, the DNA of all your mitochondria only come from your mother. And the reason is that when the sperm all get released at the same time, and they're looking for that egg, and they all start racing for the egg, and they surround the egg, and they're all digging because one guy gets to go in there and produces DNA. And if you've ever seen a picture of sperm, they look like tadpoles, and they have the chromosomes are all in the head, and the tail's wagging like crazy. That's where all the mitochondria are. And when the winner gets in, the tail breaks off. All the mitochondria in that cell come from the mom. Cell can't make them, though. They divide like a cell. So they actually split, if you remember any biology from high school again. They split like a cell. They behave like a cell. There's these things called free radicals. Free radicals is a term used to describe the byproducts of the metabolism that can be toxic to the cell. They cause damage. And they can also be produced by the environment. We've got to eliminate them. The cell has to get them out. It has to either destroy them or ship them out to the kidneys or the liver to get out of the body. So there's all different ways that we can produce these free radicals. But luckily, there's antioxidants in the environment. If we get enough of those, they're antioxidant. Oxidant is a term to describe many of those free radicals. And they tend to neutralize their toxicity. So that's a part of our natural detoxification system, is to eat antioxidants. And you got to eat more than chocolate. So there's this thing called oxidative stress. Oxidative stress is the damage that occurs inside cells that the researchers can measure in the laboratory to show what happens to the cell if the oxidants build up enough that we can measure change. It comes from either not enough antioxidants or if we have too many free radicals. The balance is off and we create damage. And the place that's most likely to get damaged is mitochondria, because they're hanging around where all the action is. They're producing a lot of it, especially when we demand that cell to work harder and they produce more energy. The byproducts of life can cause damage. And if you do enough damage, the cell malfunctions or actually dies. So cell damage can also trigger an immune response because the cells start looking weird and the immune system go, wait a minute, that guy doesn't look normal. We got to get rid of him. And we start to stimulate the immune system. And so whenever you see oxidative stress, you see evidence of inflammation. Now there's inflammation and there's inflammation. So when I went to med school, they taught me inflammation comes from the Latin word inflammare, means on fire. And so those guys back in Rome were looking at red, hot, ugly-looking things going, inflammare. There's a fire going on in your body. Then you get a little further in med school and say, you know, you don't have to have all the signs of inflammation. Maybe it's more subtle. You can only see it under a microscope. You see the cells all attracted into an area, like a sprained finger. My finger looks normal, but I sprained it. And whenever the ball hits it, it hurts because the ligaments are inflamed. And under a microscope, you can see all the cells attracted in there. The most subtle form of inflammation is you don't see any cell movement at all. But you see the chemical messengers, and you see them raised when there's oxidative stress going on a regular basis. The immune system is starting to get stimulated and sending out messages, kind of like when the Americans think there might be a terrorist attack soon and they send out the Amber Alert, like we're all walking around, everybody looks like they're behaving normally, but we're on alert. That's systemic inflammation. Oxidative stress occurs in multiple chemical sensitivities. Because there's a suppression of the antioxidants defense, there's evidence for oxidative stress. This is from a study. This is what they saw. More oxidants, accelerated damage to cells, low-level systemic inflammation. Conclusions? Oxidative stress is significant. Maybe genetic variants are of less importance. You don't have to have an abnormal genotype, but it helps. That's the citation. 2 citations. Now I've got to tell you about receptors. And all of this, again, is for a reason to help you understand chemical sensitivities. If you look, the little star-shaped guys, they get into the receptors, those blue things sticking out. But the purple one on the right won't accept the star-shaped guys, but those other types of chemicals, these are neurotransmitters. Dopamine, THC, these are neurotransmitters. And they signal the neighboring neuron if it has the right receptor to receive the message. So that's how cells talk to each other. Each chemical messenger has its own receptor. They're very specific. The shape of the receptor is like a key in a lock. You need that in order for it to work. So this is, again, an example of hormones. The circles go in the circles, the triangles go in the triangles. There's these things called hormone disruptors. And they look like the structure of hormones, but they're not normal. They're chemicals in the environment, and they hit on those receptors, and they create either a block or a stimulation, but they disrupt hormone messaging. So this is from the World Health Organization in a review of State of the Science of Endocrine Disrupting Chemicals, 2012. This is a message from Dr. Linda Birnbaum. She is the director of the U.S. National Institute of Environmental Health and the National Toxicology Program in the United States. Very important woman. Human exposures to thousands of environmental chemicals fall in the range of non-negligible doses that are thought to be safe from a risk assessment perspective. The ever-increasing data from human biomonitoring and epidemiological studies, which is the studies of pattern of illness, suggests otherwise. They're not negligible. There are low-dose effects from dozens of chemicals across a range of chemical classes. The Endocrine Society is an international society of endocrinologists, hormone specialists. And they, together with the American Medical Association in 2009, came up with this. Even infinitesimally small, very tiny, low levels of exposure to endocrine-disrupting chemicals, indeed any level of exposure at all, may cause endocrine or reproductive abnormalities. Low doses may even exert more potent effects than higher doses. The dose makes the poison. Obesogens. Obesogens are endocrine disruptors. Some of them are pharmaceuticals. Those of you who've been on antidepressants or anti-seizure medications for fibromyalgia, you can gain weight. They're chemicals that make you gain weight. They're not calories. And then there's an environmental link to weight gain. From industrial chemicals, chemicals such as, and there you see the list again, plastics, organophosphates. They're substances documented to cause weight gain. It's time to shift that toxicology paradigm. Here's the new paradigm. The traditional view says the dose makes the poison, but doesn't explain endocrine disruptors. It should be changed to the dose makes the poison, but there can be more than one poisonous dose. Low doses can affect receptors. So go back to our learning objectives. You understand the biology of chemical sensitivities and why you guys are canaries. There's stuff called capsaicin. It is in hot peppers. It's what you take a hot pepper out of the fridge and you bite it. It gives you a sensation of burning and heat in your mouth, even though it's actually cold. How does it do that? We find them also we use them in student riots. It's a very effective way of slowing people down from being violent. You just spray it at them. It can make you cough. So there's this test called the capsaicin challenge, where you bring people into a lab and you start exposing them through a little inhaler to increasing doses of capsaicin. It stimulates sensitive receptors in the bronchial tube to make people cough. Chemically sensitive patients with respiratory symptoms, even with asthma ruled out, should not be sensitive, are hypersensitive to inhaling capsaicin when compared to control groups. It's demonstrated after a double-blind challenge because you can hide it. There's 5 different double-blind challenges in the medical literature now. They weren't reviewed in that report by Desmunchin. Receptors sensitive to capsaicin, first they called them capsaicin-sensitive receptors. I thought that was a really good idea. But they found a whole family, which now has a big, long name, which we'll refer to as TRPV1 receptors. They're sensitized by oxidative stress. They're sensitive to chemicals. The receptors are found in the respiratory system, in the gastrointestinal system, in the brain, especially in the limbic system. They're involved with pain. They are in the cells of the immune system called mast cells. These are the cells that carry around the histamine. When you have a reaction, you release histamine, so you need an antihistamine. The mast cells are most likely the ones that did it. There's TRPV1 receptors there too. So, oxidative stress and chemical sensitivity contributes to the excitability of those receptors. It makes them nuts. We did some brain scans. Now, this is a little bit more controversial because some brain scans don't show abnormalities in patients with MCS, but basically, chemical challenge seems to be able to provoke changes in the limbic system we can measure in a scan. It's in research, of course. Then there's this thing called multimorbidity. Chemically sensitive patients are X times more likely, meaning you're 8 times more likely to have chronic fatigue syndrome, 7 times more likely to have fibromyalgia, and you can go through this whole list. You're more likely to have other things go wrong with you because those receptors are messed up and you're not a good detoxifier anymore. So look at that. There's the literature. It's associated with chemical exposures. You're more likely to be a poor detoxifier. You're more likely to have oxidative stress. You're more likely to have systemic inflammation, dysfunction of cells, especially those receptors, limbic system hypervigilance, and multimorbidity. Those of you who have fibromyalgia, you have a reduced number and function of mitochondria in your cells, making those cells nuts. It's actually worse when you have chronic fatigue syndrome. The ability to produce energy on demand is much more severely broken. So the classic part of chronic fatigue syndrome is minimal exertion. As soon as you put a demand on, exacerbates the fatigue because you run out of energy really quickly, and the recovery time is prolonged because they can't replace it as quickly anymore. Chemically sensitive patients are worrying the rest of us. Chronic exposure to chemicals can cause chronic illness and increased mortality, even in those who are hypersensitive. I already showed you that. So we see oxidative stress and allergies, asthma, chronic lung disease, obesity, diabetes, cardiovascular disease, neurodegenerative disorders, autoimmune diseases, and the emerging illnesses. Oxidative stress measured in every single one. And oxidative stress causes changes to the epigenome. It's also found in cancer. Poor detoxifiers. People who are actually shown to be not clinically, but in research by looking at the genome to be poor detoxifiers. I listed these things here. What does these things even mean? Any of you with a medical background will understand that these are things that make you more likely to have cardiovascular disease. There's an increased risk of ozone-induced asthma. This is literature, if you're a poor detoxifier. You're more likely to get chronic obstructive lung disease if you're a poor detoxifier. You're more likely to get neurodegenerative disorders like Alzheimer's and Parkinson's if you're a poor detoxifier. And you're more likely to get certain cancers thus far identified as lung, skin, and esophagus if you're a poor detoxifier. You don't have to have chemical sensitivities. They can come out all kinds of ways. But the canaries are saying, hey guys, you know, this could happen to you, just different. Chronic disease, this is from Stats Canada. Actually, that's a bad slide because the first thing we're looking at is the United States. 50% of all Americans have a chronic medical condition. 48% of them have more than one. Didn't start off with one. They started off with one, then they got two or maybe three. Oh, look at Canada. 80% of us over the age of 65 have a chronic medical condition. And approximately 70% of them have two or more. So something goes on, and then you're more likely to get another one, you're more likely to get another one, and why? Having one chronic condition means you can develop more. Many of them are linked to the environment. They're linked by oxidative stress. There's an increasing trend of multimorbidity in younger patient demographics because there's something going on our planet that didn't exist 50 years ago. Look at this. The illnesses in major road proximity. These are the lists. Remember that list. Just being close to that stuff. So Canadian prevalence statistics. People with diabetes, almost 2 million, almost 1.5 million with heart disease. More than 100,000 people with Alzheimer's. Look at that. So the reason we put that out there is there's lots of money being raised for diabetes, lots of money being raised for heart disease, lots of research being done. What about the guys in red? Let's go back to the learning objectives to understand the biology of chemical sensitivities and why they are canaries, and to understand how environmental exposures are changing health patterns. Hopefully I kind of coming across there. Now we need to do this. We need to tie it all together because that was one of the themes of why women. 90% of the patients that we see at the environmental health clinic are female. We don't see kids, otherwise we'd be down to probably 80–85%, because the illnesses like chemical sensitivities, fibromyalgia and chronic fatigue syndrome are relatively uncommon. They're starting to be noticed in adolescence. Younger than that, quite rare, but they're not zero. Women are much more likely to have chemical sensitivities, fibromyalgia, chronic fatigue syndrome, and the environment has a greater effect on women. These are studies. Effects of persistent organic pollutants on high blood pressure. Metabolic syndrome is increased by 23%. What metabolic syndrome is a combination of diabetes, hypertension, cardiovascular disease, problems with cholesterol. When you get that combination, the numbers are really going up in women more than men. And you're not any fatter or out of shape than we are. The incidence of asthma is much higher in women and is increasing. Why? Well, one reason is you guys have more exposures than we do. It's called gender behavioral differences. So what do? We make you clean the house. That's one. We're not giving that up so easily. In fact, I'd recommend that you guys get wives because they're great to have. But kidding aside, the way society still works is women still do the majority of housework in the home. So they have more exposures. You also do this. You put more things on your body, whether it's skincare and so on. I've had conversations with women saying, well, our skin gets dry, and maybe it doesn't get dry in men, and it probably doesn't, so maybe your skin's different. I'm not telling you shouldn't put it on there, but these are chemicals which are getting into your body. You put other cosmetics on. You ever wonder where your lipstick goes when you have to put it on again? This is just really hard to see, I think, but you just look at the number of chemicals under each red name. 15 for shampoo, 11 for hairspray. These are just a bunch of chemicals that are being applied to your body, getting into your skin, evaporating into what's called the breathing zone, maybe mixing with the ozone and some of the other chemicals, just making a mix, being inhaled, maybe going directly into your brain by the olfactory nerve. Environmental pollution exposures affect women more. So these are just 3 papers that I have citations there, looking at asthma, looking at hypertension, and taking the statistics out of this survey and showing that women are more likely to have higher exposures associated with these kind of conditions The third one was actually on osteoporosis. Women biologically handle chemicals differently than men. So the first thing is, this has been a kind of a women group advocating for separate research for drug studies. You guys aren't men with the same biology. You handle drugs differently. You make a good point when you said, how come all the research is just on men? 70% of adverse reactions to drugs occur in women. There's a difference in response to in occupational exposures, as in the literature. Phase 1 detoxification. So what does that mean? When we send things out of the cells, get out of here, get out of the body. If they're water soluble, meaning that they can be dissolved in water, they go to the kidney and we pee them out. It's easy. The ones that aren't water soluble, go, well, how are we going to get rid of them? So we send them to the liver and say, here, can you do something with this stuff? So what the liver tries to do is to convert it into a chemical that will be water soluble. We'll send it down to the kidneys and pee them out. So how does it do that? Well, there's two phases, phase 1 and phase 2. And phase 1 prepares the chemical to have things attached to it so it will be dissolved in water, which is phase 2. So if phase 1 is faster than phase 2, there's a bottleneck, a traffic jam. And those byproducts of phase 1 are very often at least as toxic, if not more toxic, than the original molecule. And women are better at phase 1. So you create a bottleneck. Our kidneys, men's kidneys, work better than women's. Women retain more inhaled volatile organic compounds. What that means is they did a study once, volatile organic compounds in the air, they don't really stay long in the body. 97% approximately comes out in your next breath. But when they compared men to women, less came out in the next breath in women. We don't really know why, but the theoretical explanation was, well, you have more fat, so it tends to grab onto these things more before it releases it, so it stays a little bit longer in the body. Women have higher percentage body fat, and this is not to be insulting, but we have more muscle. At least we used to. Sex, which is the biological differences in the limbic system, because the limbic system is reading the environment. And there's a difference between men and women. Men and women activate different parts of the limbic system when it's provoked. This is rat studies. There's sensory differences. Women are more responsive to painful stimuli. So despite the commercials for wimpy guys getting sick, we actually have a higher threshold for pain compared to women because you're more sensitive. There's a heightened inflammatory response to things compared to men. There's more of this central sensitization, this hypervigilance is found in women. It's easier to turn the limbic system on and make it stay turned on. This is where you see it. Chronic pain conditions, we see this central sensitization, we see more in women. Not just fibromyalgia, but migraines, irritable bowel syndrome, more in women, chemical sensitivities, more in women, hypervigilant limbic system. Here's another point. More responsibility. You're responsible for the next 4 generations. You've got to cut down your exposures, and you need to do it. When I look around here, talking to empty ears for most of you, you need to clean yourself up before you get pregnant. So, the perspective of women's issues is not just about job and pay and social values, etc. It should also include environmental health. So here's the summary. And I won't repeat it because I'm starting to get boring, I'm sure. But you can see all of the things I mentioned, chemical sensitivities, are also there in all the other chronic diseases that are linked to environmental exposures. Canaries are real. 80% of canaries are women. Canadian Human Rights Commission, 2007, repeated in 2014. This medical condition is a disability, and those living with environmental sensitivities are entitled to the protection of the Canadian Human Rights Act, which prohibits discrimination. It's in the Ontario Human Rights Commission, Human Rights Act, and I've been told today it's in the Quebec Charter as well. It encourages employers and service providers to proactively address issues of accommodation, ensure that their workplaces and facilities are accessible. It also includes access to medical care. You should be able to go to the hospital if you're sick enough and not be confronted with chemical sensitivities. This should be a provision. Successful accommodation requires innovative strategies. Different people react to different things at different levels. So it's kind of a trial and error. This is what we need to do. I'm sure you guys all know all of these things. Fragrance-free policy. It should just be there. You should not have to work exposed to somebody else's chemicals. People have the right to wear perfume. You also have the right to smoke. You just don't have the right to smoke around me. Jurisdictional review of community health centers. So what this is when we started to look at building that center of excellence in Ontario. And well, you do what's called a needs assessment. Jurisdictional review is, so we basically asked doctors and nurse practitioners in various community health centers around the province, what did you think about environmental sensitivities, fibromyalgia, and chronic fatigue syndrome? 93% were not comfortable with their ability to diagnose chemical sensitivities. 81% were really uncomfortable with their ability to treat it. They're just saying, this is what I think, whether they believe it or not, did not come out. Which elements of environmental medicine should be included in pursuing further education? We asked them to rank the importance. Absolutely important. Maybe, or couldn't care less. Furthering education absolutely required. These are the numbers we got from the jurisdictional review. There's doctors out there seeing people like you who are going, I don't know what to do. And I know because I talked to you and talked to you tonight before we started. People, it's really hard to get help, and my doctor this and my doctor that. But not everybody feels that their doctor doesn't believe them. But the vast majority are frustrated anyway by the fact that the doctor doesn't know what to do. And to be honest with you, I'm not really sure what to do either. But we're just starting to look at it. So we'll summarize it. Chemical pollutants are contributing to the increase in chronic illness. They're contributing to the increase in mortality. They're changing gene function for at least 4 generations. People who are poor detoxifiers are more at risk. Women and children are more at risk. There's more. Susceptible people can become sensitized to multiple chemicals. It's a multi-system biological condition. People with MCS have the right to accommodation. Accommodation includes access to medical care. Scent-free policies should be encouraged. Doctors need better continuing medical education in environmental medicine. Environmental medicine education in med schools is lacking. Government policies should encourage the precautionary principle. That's actually a term that was originally developed by the World Health Organization. It's just, we should have a principle of, if we're not sure, maybe we should back off. Better housing environment is required for those needing social assistance. People who've got chemical sensitivities who can't afford clean housing because they can't afford their own housing, they have a problem. Thank you.
Thank you very much, Dr. Molot. That was an inspiring lecture. We'll have time for some questions, if anybody has any questions. We won't take questions that are about personal problems. We obviously can't do any diagnoses here or treatment, but any questions related to this? I think they're bringing a microphone somewhere, and that way, yeah. Oh, Vita has a microphone. If you could just come down to the microphone and you can come down and sit.
Thank you for the presentation. The question I have concerning tests, are there tests in the United States or in Canada that are not covered by the government that you could measure some of either the chemicals or any of the other, the heavy metals that would you either through, I don't know, could you just comment on that? Is that question clear?
Well, there's certainly tests that you can measure these things. You have to pay for them. They're not covered, but they don't mean anything. Because it's like you come in, well, not you, but one of the ladies, I keep getting pregnant. I want to get tested for chemicals. It's cause and effect. We don't know what it means. We don't know what it means if you have 50 chemicals in you or 200 chemicals in you. We don't know what it means. What we're looking at is patterns. And the pattern says we're creating damage. But in each individual, we don't know what safe levels are. You can measure them, and maybe there will be, over time, guidelines to say, well, we see a lot more people getting sick when they have X number of chemicals, but we don't know how they interact. We don't know. And I don't know how they're going to figure that out. I'm just here trying to make noise to start the conversation that we have to figure out this better than we are. Denying that there's a problem is keeping your head in the sand. I was going to say elsewhere. But.
Broadly speaking, medical health, particularly mental health specialists, argue that behavior, even dysfunctional behavior, continues as long as there's a payoff. Unfortunately, we live in a world where bad health has a payoff. Some people are making money. What medicine do you have that would change that? So that we would have companies have better working environment, better housing. Even the medical profession, the pharmaceutical profession makes money off disease rather than good health. So how does one get this change in perspective that is obviously needed?
Well, that's a good question. But if you look at money as a driving force, and it clearly is, has been since we invented money. We used to trade sheep. Now we trade cards. If we're going to make a change, it reminds me of when I was an intern and sitting in the case room. The case room is where, not the case room, but the change room. In the case room is where babies are delivered. And there were two obstetricians having a conversation. And one of them said, "There is no way I am ever going to allow a man in my delivery room because he's going to touch things, he's going to faint, he's going to throw up, he's not going to be able to handle the stress. There is absolutely no reason why they should be in there. What good could possibly come of it?" So here we are 40 years later. What do you mean you're not going to have a partner in there? Everybody has a partner in there. What changed? What changed was women demanded it. There's no studies to show, no double-blind studies to show that it makes a difference, but it clearly, logically, and making your patients feel better about the experience, it was the patients that made the change. So when you look at other things from 40 years ago to now, you can go into almost any grocery store and you can buy organic food. Well, 40 years ago, it was the guys with the long hair smoking that funny-smelling stuff that were doing that kind of thing, and there's maybe 1 or 2 stores in every city, if at all. What changed? Demand. So what's going to change is if everybody buys a hybrid, then the car manufacturers are going to produce more of them and lower the price in competition. If you're going to wait for the politicians to make all the changes, it isn't going to happen. If you're going to wait for the people to make money, the only other solution then is make me a benevolent dictator and I'll change things. It's not going to change. You, we, everybody has to change. And that's the reason for this conversation. So you have to get the conversation out there. Canaries have a message. You got to get it out there.
Hi. Thank you for a very, very nice synthesis of environmental health. I'm Donna Mergler from the University of Quebec in Montreal, and I'm also head of a CIHR team on gender, environment, and health. I really enjoyed your talk. I will take issue, however, with the fact that of women being more sensitive. I would put it that women and men are different. They have different exposures and different effects. MCS indeed, the prevalence is higher in women than in men, and it's not sure why. There are different exposures and different biologies, but the example of that medication, that women have more have more adverse effects from medication, comes from the fact that most of the clinical trials were done on men. Both of us come from that generation where the average human was a 70 kilogram male, usually between 20 and 30. So I would just stress more the differences that are due to exposure differences and biological differences rather than one gender, sex is more sensitive than the other. Though there is a difference in the distribution of diseases because of the biological exposure differences.
I accept the criticism partially. I don't necessarily disagree with you, but I'm right too. Women have more sensitive limbic systems. Women don't detoxify as well as men. Women have more exposures. That's the way the world works. And when you look at health, you don't isolate just the environment. You look at all the determinants of health, all clearly, you know that too. And they're all linked. I'm really just trying to make a point. But the point is that the ones that we see clinically, the ones that I have seen, the 12,000 canaries that I've seen, the people who are referred constantly from all over Ontario to our clinic, 80, 90% of them are women. So maybe my explanation is wrong, but they're clearly being hurt much more by the environment than men.
On the other hand, if you went into, on the other hand, up until particularly recently with musculoskeletal disorders, if you went into an occupational health clinic, it would be the majority of people who were there would be men, and one could from that assume, the same way it has been assumed for a long time, that men have occupational illnesses, whereas women have fewer occupational illnesses, which is not the case. I mean, women and men do different works. And I agree with you that the exposure, I mean, you showed this really well, particularly with the exposure, that we know very little about women's exposure from household items, from cosmetics, and even in their workplace. It's very complicated because we have studied men much more than we have studied women. So.
Oh, I can't disagree with you. We have studied men more. You're absolutely right. Thank you.
Hi, I'm Lucie Montpetit, occupational therapist. Thank you for making the book. I think it's another step in the right direction for supporting the people here, but also for doctors to have something that has references on. And I think it's very important that the words is spread out to the community. And I'm happy we're having this in a university rather than in a hotel somewhere. I think there's also a step in the right direction. So thanks again for making this book. I'm just going to comment about women, men, whatever. I think we have also a different hormonal system, and you talked about endocrine disruptors, and I think they affect women more, and that also adds a load to the liver. So we also have a cyclic hormonal balance that's different from men, and I think it plays a role. That's what I see if in my patients when I have them follow a routine. I think it really follows the hormonal cycles of women, and we can figure out when they're more sensitive in their cycle as well. Just a comment on that. I don't know if you want to.
Estrogen does have a stimulating influence on the inflammatory response too.
Yes, I agree. I'm concerned about molds because I would say half of my patients with chronic fatigue and multiple sensitivity, a lot of them, it seems that it comes from mold in their work environment. And I don't know, I mean, you haven't discussed mold very much, but just as I think molds are molds and there may be a problem on their own, but there's also the toxicity of the molds that can provide in the environment. I don't know if you can further develop on that topic.
When we look at a group, so a large building which has water intrusion, water damage, and obviously within 24 hours you're going to see mold growing. So we strongly correlate water intrusion to the evidence of mold. And so, well, and the most well-documented, well-accepted correlation with that kind of an environment has to do with respiratory illness. So asthma, nasal congestion, recurrent infection, and so on. There's a strong correlation. Very few people are disagreeing with that. But when they go in there and you say, well, these people with runny nose, and ever since this happened, and it's worse when they go in the building, or asthma, or both, and they test them for allergy, less than 40% of them have a classic allergic response, whether you do it through skin prick testing or you measure IgE antibodies. So, well, what is it? Well, we're really not sure. Maybe it's not mold. But here's what happens. There's the parts of the mold that I mentioned as well, which are pro-inflammatory. There's chemicals called mycotoxins. So there's literature to show that people who have chronic mold exposure actually are secreting them more in the urine. Are they toxic? No, the term mycotoxin implies it. But there's debate. So we see pro-inflammation. We see different chemicals. There's volatile organic compounds that are increased in the air that come from mold production. You go into a damp basement and you say, oh, it smells damp down here. You're not smelling the vapor of water. You're smelling the byproducts of whatever's growing in there, which is usually mold. So there's chemicals from that. There's the mold that when it's growing on the drywall that got all wet or your furniture that got all wet, it's actually eating those products. That's where it gets its food from. So those products are breaking down. We see increased volatile organic compounds in the air coming from water intrusion. And then there's bacteria, and there's dust mite poop. I mean, there's a soup. It just changes the quality of the soup and makes it worse. The exact mechanism is really not clear, but I don't have a problem with your observation that people who had significant mold exposure are more likely to develop chemical sensitivities or chronic fatigue syndrome. I don't have a problem with that observation, because it's like, but we also have observations where people develop these things because they had a major psychological stress. Something wires that system. Yeah, we have to stop separating out the different organs like they don't talk to each other, because it's wrong.
One.
So there is a connection between mold exposure and the development of MCS? Or
There can be. There can be. Yep. Save the question.
Hi. I just have two practical questions. I would like to know if there's any value to an air purifier when you live in an urban environment, especially close to a big road as described in your conference.
Precautionary principle, logic, is, everybody should move out to the country. But then we'd all live out there, we'd form new cities, we have the same mess.
Meanwhile.
Right? So logic dictates that it would make a difference. The literature says the same thing. Okay. If you're going to get a HEPA filter, there's a thing called MERV. It's minimum efficiency removal value. I had to memorize that for tonight's talk. MERV. You want to have a MERV above 12. You can get it as high as 16. The literature says between 12 and 16, not that much difference. But there is a significant reduction in particulate matter. They claim to remove 99% down to 0.3 microns, but that's what's going through the machine. This is just my own opinion. I cannot base this on any paper. My opinion is that you should have a better ventilation system and clean the air as it's coming in. The literature also says that a central way of cleaning the air is more efficient than portable.
Are you talking about the air exchanger systems that they need to put since 2008 in new construction?
Yeah.
Yes.
But you don't have to, if your house is built before 2008, you don't have to have one.
Yeah.
So my wife and I had this experience quite recently where we renovated our house. And the house was built in the 70s, and it had a fuse box with all these wires in it. So I asked the electrician, can you clean that up? Like, it just makes me nervous to have those wires in there. So he said, well, I'll take a look at it. And he came upstairs. He said, yeah, I can clean it up. He said, but you don't want me to. I said, well, why not? He said, as soon as I start touching it, I have to bring it up to standard by today's rules. And so I said, well, that's okay. He says, it's going to cost you over $1,000. I said, why did they change the rules? He says, well, they think it's safer. I said, well, then it's worth $1,000 so our house doesn't catch fire and kill us. So we changed the rules, but we only change the rules from now on. So if you live in a house built in 2007, you don't need an air exchanger, not by law, but by logic, you should get one.
Of course, absolutely.
And clean the air coming in.
Yeah, with
What
filters.
works best, thus far, opinions in the literature, to clean indoor air is reduce sources of contaminants.
Yeah, from the inside of your
Yeah,
home.
so we start with what we bring into the house that we use every day.
Definitely. Thank you very much. Second question is there a reliable test to test oxidative stress?
Apparently there's some labs in the States that are looking at it. But some of the tests are, for example, taking cells and measuring the level of certain antioxidants that are at high level usually in the cell. And if they're lower, we can assume there's oxidative stress. They do tests where they'll sometimes challenge the mitochondria, challenge the cell, keeping it alive, to do something which requires energy. And then measuring chemicals with big, long names that the mitochondria use to produce the energy, and they should drop. You say, well, the mitochondria are using the energy supply, and therefore the cell is working, the mitochondria are working. So these are things mostly in research labs, and I know there are some private labs in the States that are offering it, but around here...
Anything we can use right now? Not really.
No, but...
or any research lab we could follow?
Off the top of my head, I can't give you any names because I don't know. What we're looking at, hopefully, if we do get this center of excellence, is that we can start looking and measuring these things in a research-oriented fashion, but gathering the data, and then trying to figure out if we change things. For example, if we measure low antioxidant levels, if we treat people by giving them to them either orally or intravenously, if we change the numbers, oh, you got better looking numbers, do we change them clinically? We don't know. It's only based on logic. Makes sense? Mm-hmm. I tell all my patients, salad is the main course.
Yes.
Like you need to get 7 to 11 helpings of fruit and vegetables per day to try and get as many antioxidants in there as you can. And there's 1,000 of them. So going to the health food store and asking them, the guy who works in the health food store, to work his way through university, and ask him what's the best antioxidants to take, and if he gives you an answer, I don't know where he gets it from.
And that is, that's reaching my third question. A lot of studies, like new studies, are questioning the use of antioxidant taken in supplements. What is your take on this?
Well, they tested long-term use of antioxidants, and they showed an increased risk of mortality. Yes. The antioxidants that they were measuring were vitamins B, C, and E. They're relatively minor players. When one measures evidence for oxidative stress inside cells in the research lab, you don't even see them measuring those. Okay. They're minor players. I don't know what it means. I know that's out there. I don't know whether it's worth it. I think for those of you who have chronic illness, who would like to have a reduced number of years but get their life back? And I'll bet you the majority of people go, I'd rather have a lot better years and cut it a bit shorter than live like this forever. So it's risk versus benefit. I don't know, but I think those few studies that have been produced are vitamins.
Okay, and the supplements that will maintain or multiply your mitochondria.
Sorry?
For the next person.
Yeah.
There are people waiting behind you. So you've already
It's the last one.
Yeah.
I thought it was interesting for people because it's pretty much important, but hey.
Well, the others might have important questions as well.
I'm sure too. So any answer to that one? Is it the same?
I didn't know
the
what
supplements
it
for
was.
the mitochondria.
Which ones?
Resveratrol, taurine,
They're all
alpha-lipoic
good,
acid.
but a lot of the ones you mentioned are shown to be reduced in oxidative stress.
Sorry?
So a lot of the ones that you mentioned are shown to be reduced in oxidative stress.
Okay, so they're mainly positive.
They're mainly positive?
Well, it's positive.
To take them
it's
seems like you would raise the level. Logic says it should help, but we don't really know.
Yeah. Okay, thank you very much.
I would like to know what percentage of people that you treat for chemical sensitivity that are also electrosensible?
Percentage? I don't have a number in my head. I'll tell you what the literature says. The literature says that those who report environmental sensitivities, 20% of people with chemical sensitivities might report it. When you look at people who have environmental, electromagnetic hypersensitivities, 60% of them report that they also have chemical sensitivities. In the last 2 weeks, there was a paper published looking at genotype for detoxification and looked at people with chemical sensitivities, electromagnetic hypersensitivities, saw abnormalities in both groups, not the same. One paper. So is there something about detoxification? You go, well, what would that have to do with electromagnetic fields? And I say if the sensitivity exists because at this stage, the level of evidence to support the illness in the literature is where the MCS literature was like 15, 20 years ago. So I'm just trying to kind of state what the literature says. That's really my job, is that, hey, the literature is a problem. When we look at people reporting these things and say, why would detoxification make a difference? Say, well, if you damage the cell membrane, every cell membrane has an electric charge on it, especially the neurons. That's why we do EEGs. We measure electric currents in people's brain. So could those membranes be reacting to these things? I don't really know. Because the literature that says yes is sort of balanced right now with the literature that says no. It's best I can tell you, percentage-wise, is those statistics I gave you.
Okay, because I know a lot of people who are chemical sensitive that are also electrosensible. So
well, I know a lot of people that report it too.
Yeah.
But you asked me for percentage, so that was the best I could give you is there's a difference.
But do you know how come it's because the cell membranes is attacked?
I'm sorry, I couldn't hear you.
What's the link between the two?
I don't know. I don't know if there's a link. I'm saying this is what's reported, and I'm trying to go, why would that be? So I'm trying to understand it. That's just me, because I'm part of that dialogue. But I don't know.
Okay.
Why that person and not this person? I don't know.
Yeah, I know. Okay, thanks. Well, I think it's kind of sad that we use Wi-Fi technology here, knowing that a lot of people can be electrosensible too.
Good point.
Yes, I have this problem. Hi, Dr. Molot. My English is not very good. Okay, I try.
If you talk in French,
Oh,
I
yeah?
can.
Ah, oui.
Oh, no, I can't.
No, not work? That's not work?
Well, with this.
Okay, I try. I don't understand good. Somebody can help me? Yeah?
Okay.
OK. On parle du problème de... moi, j'ai vu encéphalique. Il parle de problème... j'ai vu les papiers par rapport à Dr. Belpomme. Il parle de champ encéphalique, la barrière encéphalique. Il parle de quoi? De barrière encéphalique. Talk the problem, and for what? Because the pollution and stuff like that. Okay, for stop this problem. There's nobody have the power for stop the pollution all over. You have a problem, the Dr. Belpomme, he talked, Dominique Belpomme, it's the encephalic, it's open here. I take it off my mercury, inside gray, silver, inside my mouth, okay? I see you before, I take it off that. in Ottawa, and I take it off, and my body is better bad now. I'm not feel better good. I feel better bad. And I try for explain. You understand me? Or not really.
Your metal out of your mouth and you feel worse.
Worse.
Is that what you're saying?
Yes.
Vous êtes pire.
Yeah.
Alors, c'est quoi la question? Parce qu'il y a
OK. La question, c'est que
5 minutes, là.
Bon, la barrière encéphalique, selon le docteur Bellepomme, ce qu'on a lu à date, dans notre compréhension, c'est qu'il a mis un protocole pour fermer la barrière encéphalique.
He is a fellow who has a protocol to close the blood-brain barrier, Dr. Bellepomme.
Docteur Bellepomme, c'est un monsieur qui est oncologue, qui travaille en France et qui a fait beaucoup de recherches sur au moins 200 personnes avec des hypersensibilités aux champs électromagnétiques.
So he works with electromagnetic fields, at least 200 people, and he was working on it. Okay.
Et l'affaire qu'il y a, c'est qu'il y a un protocole pour fermer. Il dit que les champs électromagnétiques, les métaux lourds, ont la propriété de faire des trous dans la barrière encéphalique.
He thinks certain heavy metals have a property to make a hole in the blood-brain barrier, to interfere with the blood-brain barrier. That's his.
Rendre ça perméable, peut-être, là, disons. Et le problème qui arrive avec ça, c'est que il arrive sur 60%.
Est-ce qu'il y a une question à la fin?
Oui, c'est que, en fait, c'est qu'il arrive, lui, il dit qu'il y a un protocole qui établit que 60% des gens, il n'y a pas moyen de guérir de ça si on ne ferme pas la barrière encéphalique. En fait, c'est ça, et on se demande si vous avez un protocole, quelque chose pour fermer cette barrière-là, que si elle n'est pas fermée, c'est comme si, quand on ne met pas de passoire, je dirais de moustiquaire à nos fenêtres, finalement, les métaux lourds, tout traverse tout le temps, donc on ne guérit pas, ça reste toujours hyper fragile.
Okay.
Avez-vous une solution pour fermer la barrière, je dirais, ou un protocole pour le faire?
If you have any ideas about closing the blood-brain barrier?
Me personally, no. Pardon?
The problem is it's finished. The problem is in Europe.
So wait. We're just asking. Well, there's 2 more people, and we're finishing in 5 minutes. So if that's the question, he doesn't have an idea.
It's not 5 minutes. Just once again. I'm just finished. I'm coming here, okay, and I listen. I read about this problem. J'ai lu, okay. And I asked somebody I can understand in Quebec why you don't have this problem. You don't have the protocol.
So there's not a protocol. So
And they give them the patient.
No, but you're asking the wrong person the question.
If I can just make a comment, let me just make a comment that when somebody comes up with a solution, people, I understand. I'm trying to explain to you the system, right? So someone comes up with an idea. It requires examination and study to see if the idea really works. That's having said that, if you're going to do things that are not well supported as yet, there is a risk of criticism from peers because it's not well proven. That's just the way our system works. I didn't say the system is right. This is the way the system is.
But working together for help the people all over on the ground.
Well, no, sorry, could you just, Pat, could we have the next person?
It's more complicated than that.
Sometimes I like to look at things very simply because that's a good place to start. I don't understand why smoking is still permitted, or excuse me for quoting you more or less, but you said people have the right to smoke as long as it's not near you. I can't walk down the sidewalk in Montreal without being accosted by the 52 chemicals that cause cancer that come from every single cigarette. The majority of immigrants that are coming to Canada are chain smokers from Russia, from China, from Arabic countries, from abroad. They haven't had the no smoking education that Canadians have had. So what hope is there for us when smoking, which to me is very obvious, well-known carcinogen, is still allowed? And if you move to the country, which I have, skidoos are allowed. And these are leisure vehicles in most areas, except up north, where there are no pollution standards, no noise standards, and they ruin the entire countryside all winter long. So what hope is there when such simplistic things are still permitted by our government?
I mean, if you're asking me to explain why government allows the continuous ability to obtain things that are causing death, causing illness to people around them, that pollute the environment, that are addicting. But people say, oh, it's because of money. I don't really know. That's not for me. I will say this. Things certainly do work slowly. One of the points that I made tonight was that the government, at least public health in Toronto, tried to reduce pollutants. We closed the last coal burning place in Ontario. So the numbers, air pollution generally has gone down. Numbers have gone down. You and I look at that and go, it's really slow. I agree. I do not know how to change the world. I just know the world changed chemically, and so did health patterns. And we have the evidence for that. And so this is a place to start conversation, but the conversation should be going everywhere. I do not know what the answers are. I have no training in sociology or any understanding of having humans has been in my own personal experience. I don't know the answer.
Wonder
Sorry,
what percent. Thank you for
Yeah.
the most amazing lecture.
Thank you.
This will be the last question. We're running out of time.
I have a question from a friend of mine suffering from MCS who couldn't be here tonight. He asked me to ask you, like people suffering from MCS have a problem absorbing vitamins, and at the same time, we have a hard time taking supplements, vitamin supplements. And he asked me to ask you, is there a way to deal with that, maybe with the food or in order to be healthier?
Just trying to be funny, but I have two answers. I don't know and no. Because I don't. I think when we look at the literature, and that's what I'm trying to do, is say, look, here's what the science says so far. I'm not sure how much evidence there is for poor absorption of vitamins from the gastrointestinal system. Because somebody wrote it doesn't mean there's a study, right? I don't know that. But if they also have irritable bowel syndrome, which is more likely, and if they also therefore have problems with absorption, then maybe there's a problem. So we can use logic. But I don't know what the solution is. And there's nothing magic out there. And vitamin, the actual pure vitamin, we're dead if we don't have the vitamins. But where do we get them from? And what's in there? And how do they make it so that we can absorb it, etc.? The incipient ingredients and tablets and so on. When people have severe chemical sensitivity, they're sensitive to all kinds of things. And it's sometimes just putting something into the body that is just different is enough to make the body react. Because the body's nuts. I didn't say you guys are nuts. How this thing works is nuts. So you hear this all the time. Solutions? I don't have any. The only thing we can think of is how do we calm the limbic system down? Whatever stresses there are, whether it's coming from things that you can control, like a bad marriage, or the chemicals in your house, they're all stressors. How much of them can you reduce? And then how do you calm down? The psychiatrist will tell you, well, take a pill. But you guys can't take pills. How do you calm the limbic system down? Well, there's exercise, relaxation theory, hypnosis, biofeedback, things. None of these things are magic answers. It seems to me that people with chemical sensitivities should spend all day just trying to get better. And if they could do all of these things all the time, maybe they get better. The problem is that we're not going to figure out how to make people better when nobody's funding any research to try and understand really what's wrong and how to fix it.
Thank you very much.
Thank you very much, Dr. Molot. Wonderful evening. And thank you all for coming. It was great seeing so many people. On the way out, if you would like, there's a petition that's going to the National Assembly in Quebec. Huh? Oh, okay. There's one here if you want to sign it. We're asking for chemical-free institutions, you know, that they're sensitive in the hospitals, et cetera, for people with multiple chemical sensitivities. And there's actually one copy here. The others are in the car. So if you want to sign it, you're welcome. Thank you all very much. Good night.